Good morning. Good morning, everyone. Thank you for joining Senator Sherrod Brown's first virtual Black Women's Health Symposium. My name is Renee Mahaffy Harris. I am the president and CEO of the Center for Closing the Health Gap, known as the Health Gap in Greater Cincinnati. And we are so proud to be a part of a conversation and movement to address Black women's health in the state of Ohio, but most importantly in our country. I am really excited about the fact that our Evolvement Committee of the Black Women's Health Movement in Cincinnati has been working for over a year and a half, doing focus groups and working with women across Greater Cincinnati, and now aligning and linking arms with women across the state of Ohio. And most importantly, our leadership from our Senator Sherrod Brown. He and his colleagues have begun to pose the question and address the issue of racism as a public health crisis in this country by their introduction of a motion to address and declare racism a public health crisis in the United States, as well as the fact that our state legislature and many cities and municipalities and counties complex. However, what we are going to talk about over these next 2 Saturdays are what we believe from the Black Women's Health Movement are 4 pillars that impact our health. Our community's health, our physical health is what we will address today. Next Saturday, we will address mental health and economic health. But none of this conversation would be possible without the leadership of Senator Sherrod Brown and his colleagues in the Senate and House, who are championing the facts that the maternal health outcomes for Black women are 4 times that of white women. And the question for that is why? The question is why? Race is that construct. So we are going to explore over these next 2 Saturdays with expertise from across the state of Ohio, why that is, and then what we can collectively do to begin to change the outcomes of our health in Ohio and across this United States. I am, again, very grateful to be working with Aaliyah Brown, Senator Brown's Deputy Director for the state of Ohio. She is an awesome woman who has made all of this possible today. And I'm happy to have been working with her through our work over this last year. But Aaliyah has been the champion who has driven us to this point to launch today this virtual conversation on Black women's health. So without further ado, I'm going to switch to introducing my dear friend who I had the pleasure of working for when he was Secretary of State, and to watch his plummeting, skyrocketing achievements to the Senate and all the work he is doing to fight the inequalities, injustice, and injustices for Black people and other marginalized populations across the state of Ohio and in our country. So I am so honored today to introduce my friend and our U.S. Senator, Sherrod Brown. Well, as Senator Brown joins us, I will soon be handing over our moderation to Kyla Woods. She is our moderator for today. As technology goes, sometimes it works, sometimes it doesn't. And this morning, we have all given each other grace because that's the grace God gives us every day. But we have to have grace in these times with technology. So I think that Kyla's ready for me to turn it over to her. Yes,
Yep.
so I am going to turn it over to our moderator for today's Black Women's Health Symposium, and I thank each of you for joining us, and I thank all of our panelists for the expertise you're going to share today and our closing tools you can use. So, Kyla Woods.
Thank you so much, Renee. I appreciate that intro. And of course, we are giving each other grace today. My name, again, is Kyla Woods, and I'm so honored to serve as your moderator and MC. I also had some technical difficulties this morning, so that's why I was a bit delayed in getting into the program today. So we are so thrilled to have all of you with us, joining us online for the inaugural Ohio Black Women's Virtual Health Symposium. We are going to have such an incredible conversation today, a really insightful and engaging conversation covering some really, really important topics, of course, all centered around Black women, because we have to talk about our health. We have to talk about how it impacts us personally and how it impacts our entire community, and how we are the glue that holds health together for our families. And so, again, this conversation is just incredibly important, and I'm honored to be a part of it. So we are going to hear from Senator Sharon Brown, of course, his office helping to coordinate and organize this event, and we're so grateful for them. But I think before we get to Senator Sharon Brown, I think we're going to go to House Minority Leader Emilia Sykes. If she is ready, I think we're going to go ahead and go to her first, and then we'll get to Senator Brown. Thank you all again for bearing with us in live virtual land. We have to pivot and we have to give each other grace, as Renee said. So thank you for that. And I'll send it over now to Emilia Sykes.
Thank you, Kyla. Appreciate that introduction. And thank you, Renee, for setting the stage for what should be a wonderful 2-weekend event. To everyone who has decided to join us early on a Saturday morning, thank you for your commitment to Black women's health and being willing to participate in this conversation and carry it on in your communities and onward. And finally, to Senator Sherrod Brown, our great senator from the state of Ohio, thank you for convening all of us for this important conversation. Many of us have been working on the front lines, behind the scenes, in front of the scenes, trying to uplift the conversation around Black women's health. And it is always helpful when we can have an ally in a position where you are to help us as we uplift the voices and the stories of the Black women in this state and Black women, quite frankly, across this country, and making sure our needs are being met. You know, the issue of Black women's health is something that I could talk about for hours, but I don't have that much time. But I want to talk about a couple of things that are really important to me. And most of the time when we talk about women's health, Black women's health, anyone's health, we don't often think about the economics of that and how having a good job that pays livable wages or a home to stay in is so impactful for someone's health. We hear our senator talk about the dignity of work on a regular basis and having meaningful employment, getting equal pay for equal work, not having wage theft. All of these things are a part of your health, and perhaps not the thing that we talk about all the time. But as we continue these conversations this week and the next, I want you to think about that lens and framing what good health can look like in a financial, economic way. You'll start to realize when you get your health insurance based solely on your employment, and when you have a large majority of wage earners in low income, minimum wage jobs that don't have paid sick leave or paid time off or family leave, that can impact someone's health. I say that because in the state of Ohio, we have not had a General Assembly or legislature that has been particularly helpful in talking about these economic issues as it pertains to Black women's health. And Black women across the spectrum have continued to see the negative impacts of this failure to act. And so as we talk about Black women's health, let's think about it in the economic sense. I have a master's degree in public health. And when we talk about public health, it's not just simply the absence or presence of a disease. We're talking about the full human experience and what that means for that person. And for Black women, that full human experience is sometimes not as wholesome as we would like it to be, not due to any fault of our own, but because of the systems that have been created in our communities that make it impossible sometimes for people to live well. This is articulated best when we look at our infant mortality rates. When our most vulnerable citizens can't survive their first year of life, that is a systemic failure based on the fact that the women who carry these precious lives are unable to live in a world that protects them, that supports them, that cares for them. And now their infants are unfortunately the ones who have to suffer. You know, the coronavirus has exposed a lot. It has exposed the racist systems in our communities, but it has also shown how our public health infrastructure has failed us. We've talked about often that there are two pandemics that we're experiencing. Not only is it racism, systemic racism, but it's also the coronavirus. But when you look at those two issues and who it impacts the most, Black women continue to bear the brunt of both of those burdens. And many people have talked about the coronavirus as exposing these inequities, but that's a bit offensive to me. Because for many of us, we've known these inequities existed. We've lived with these inequities. And to simply say the coronavirus has exposed it completely ignores our cries for help, our pleas for support. And so I reject that notion that it has been, we have exposed these types of disparities because they've always been there. People just have refused to see them. But what we are doing with the help of Senator Brown and all of the people who are on this call this week and next are making it very well known that we are not going to continue to accept these types of disparities any longer. Now, as we talked about coronavirus being at the forefront of these conversations, everyday issues such as heart disease, high incidence of cancer and cancer deaths, and diabetes in Black communities also impact women. The leading cause of death for Black women is heart disease. We have to talk about those issues as well. And while coronavirus has our attention at the moment, we cannot forget about these other issues that continue to plague and ravage our communities and make living much more impossible. So I'll say this as I close. I have a colleague who says and reminds us all the time, it is hard and it's stressful to be a Black woman. But I hope that we can reframe that conversation, because what in fact is stressful is oppression. Injustice is stressful. It is not stressful just being Black, but the trauma and the stress that comes along with oppression, discrimination, injustice, and unfairness is what makes the Black experience stressful. And so for everyone, as we've talked about these conversations, we know them, the research is there, it's been there for a very long time. Let's figure out the solutions. Let's talk about what is next. Let's talk about how we dismantle these systems and create a world in which Black women can live and thrive in health and wellness. We are not problems. We have just been forced to survive them. And we have survived them. And as we have heard, and as Maya Angelou told us, still I rise, and we will rise. And so together, with the help of good folks like Renee and Kyla and Senator Brown, we will rise. Thank you so much for letting me be here with you today, and I hope you enjoy this Black Women's Health Symposium.
Hi, all of you. Sorry for the little delay there. I'm Sharon Brown. Thank you so much for joining us on an early Saturday morning when you're all so busy. Thanks. And to Ms. Woods, thank you for helping to host this. Aaliyah Brown in my office, our assistant state director, who's just a superstar, lives in Cincinnati, lives in Wyoming, and she is just everything she touches works so well. Renee, my longtime friend, Renee Mahaffy Harris, whom I've known for 25 years, thank you. Leader Sykes, think about this, the Democratic leader, the most powerful elected Democratic official in the state has a master's in public health, and how important that is, and her insight into sort of all things healthcare and all things public health especially, but so much. Emilia, thank you. Linda Blount, thank you as President of National Black Women's Health Imperative, and to the panelists, thank you so much. And sorry for the little mix-up today. I just, sometimes my technical skills, even though I've been doing this for we all have for months now are not quite what I hope they are. So couple things first I wanted before doing some more substantive discussion as Emilia was doing. I would like everyone to share their stories and engage in social media. This, as you know, is one of 2 Saturdays we're going to do this. Originally it was going to be one all day in Cincinnati when we initially planned this before the pandemic. But you go to use hashtag OBWH, Ohio Black Women's Health, OBWH 2020. Tell your stories. We want to lift up your voices, and for much of America, the stories you tell will be illuminating. So thank you for that. Second, we want to make sure all of you know that our office is here to help. We have a team of caseworkers in our Ohio and Washington offices whose job it is to help people, whether it's with Medicare benefit or connecting you with other resources. You can always go to brown.senate.gov to get in touch with us. It's our job to advocate for people in this state, kind of writ large. It's also our job to advocate for people individually when they face challenges that interacting in some case with government. When we began working with women around the state, like Ms. Harris, on these issues, to talk about how we can do more to improve health for African American women and address the persistent social and racial gaps in all the underlying social factors that determine people's health, education, housing, the justice system, job opportunities, environmental hazards, toxic stress, all the kinds of things that Leader Sykes talked so compellingly about. We held roundtables around the state in person beginning last winter. As we had these conversations, we talked about the great work being done in Ohio and the need to elevate these conversations and connect leaders from across the state and nationally. Then the coronavirus hit. This pandemic, as you know, has been called the Great Revealer. It revealed racial disparities in this country, disparities you all know about. You're watching this today. You are activists. You are part of this. You are practitioners. You are all these things. But to much of America, they didn't understand the racial disparities in housing and healthcare, infant mortality, maternal mortality, life expectancy, the disparities in the justice system, disparities in the education system. My 4 grandchildren who live in Ohio, we have 3 others, but the 4 in Ohio, they're in the Columbus City schools. The Columbus City schools didn't open this year for in-person learning yet. We hope they do, because they simply didn't have the resources that a number of the suburban schools opened that are within our higher income neighborhoods, the suburban schools that opened in person. And President Trump and Mitch McConnell didn't care, didn't put any money into public education to help the big public school systems that have some of the highest numbers of low income kids. That learning gap grows wider. You know that's come out, and that's one of the great revealers out of this pandemic. But it's not just been a revealer; it's been an accelerant. We know who is disproportionately getting sick and dying from this virus. It's Black and Brown Ohioans. One grocery store worker in this part of the state, Southwest Ohio, said to me one day, said, this isn't, they tell me that I'm essential, but I feel like I'm expendable because they don't pay me much and they don't protect me at work. And we know who the essential workers are. They're more women than men. They're disproportionately people of color, and they're generally lower paid employees. And putting yourself in their situation, and some of you are in this situation, you work all day exposed to the public. You come home at night exposed to potential virus. You come home at night always anxious. Am I possibly infecting my spouse or my children or the people that live with me? We know that this pandemic and racial justice are not separate issues. We know how intimately connected they are. Black Ohioans have less access to health care, making up the communities hurt by the Black codes, then Jim Crow, then redlining, and all mixed in, and now the Trump administration locking in discriminatory housing practices. We obviously need to do more to make sure that to lift up voices and create a system that actually works for African Americans and particularly African American women. That's what this event's about. We have panel discussions and workshops and speakers this Saturday and next Saturday addressing physical, community, economic health, and mental health, which we know is a persistent and growing problem coming out of the pandemic. We worked together to plan this symposium with experts like Ms. Harris, who've been doing the hard work on these issues for a long time. We want to hear direct feedback from you. It's part of a commitment to engage with communities that have been silenced for too long and to work together for long-term change. We know the best ideas don't come out of Washington. They'll come from Black and Brown communities who've been living with these inequalities and fighting this fight for generations. That's where the idea came from for a resolution we introduced this summer, declaring racism a public health crisis. At the federal level, a number of Ohio cities and counties passed resolutions declaring racism a public health crisis. I followed their lead. I went to Senator Kamala Harris, Senator Cory Booker, Senator Schumer, others, asked them to join in my resolution. And so far, President Trump and Mitch McConnell aren't interested. We continue. We look next year, understanding that doesn't solve every problem, but you've got to identify the issue to the public at large, and a resolution declaring public health declaring racism a public health crisis is a significant start. I'm excited about the ideas that will come out of this conference and the conversations Ohioans will have over the next 2 weeks. And I will close with a real brief story. About 2 months ago, Senator Jones of Alabama asked 5 senators to come to the Senate floor and read from Dr. King's letter from the Birmingham jail, 1963. He asked me to be one of those because I had joined my longtime friend, Congressman John Lewis, in the first congressional delegation of about 10 people he took to Selma back about 23 or 4 years ago. So Doug asked me to come to the floor and read from that letter with several other senators. And he let us pick the parts of the letter we wanted to read. And I took the part that has my favorite Dr. King quote. And that quote, he was, if you remember, talking to white moderate, so-called moderate white ministers that were pro-civil rights, but didn't want to get there too fast. And that was what King's admonitions were, to talk about the urgency of now. The quote that I like so much is Dr. King said, "Human progress never rolls in on the wheels of inevitability." Human progress never rolls in on the wheels of inevitability. Dr. King recognized, of course, as we all do, that progress rolls in because of leaders like you who do the work every day in the vineyards to make a difference for your sisters in the movement and for women everywhere and African Americans everywhere. And your engagement today will be so helpful. So tell your stories, share them with all of us. It can really matter. So thank you so much for being part of this. I will turn it back. I believe I'm turning it back now since the order was changed, since I messed up my getting on this call, and I apologize again for that. I'm either turning back to Ms. Harris or perhaps to Ms. Woods. I'm not sure. So thank you so much, all of you.
I'll take it. Thank you so much to our U.S. Senator Sharon Brown. Thank you so much for that compelling message and that encouragement for us to continue in this work and to continue to share our stories. And of course, right before Senator Brown, you heard from House Minority Leader Emilia Sykes. We thank her for her time this morning and for sharing that message with us as well. We are so grateful to have your advocacy, your allyship, and your leadership for our state, for us as engaged citizens and as Black women. So we really, really appreciate that. A couple of other housekeeping notes and then we'll move forward with the rest of our program. You heard Senator Brown mention that hashtag. We want you to share those stories online. Please share those using the hashtag OBWH2020. Again, that's hashtag OBWH, Ohio Black Women's Health 2020. Make sure you're sharing those stories online and sharing our experience today so everyone can see what's going on and how important this conversation is. Also, we'd love to hear your questions. If you could share in the chat your name, where you're writing us from, and share any questions that you may have for our speakers or our panelists as we go throughout the day, and we'll get to those later this morning. So make sure you're sharing those in the chat. Moving right along at this time, I have the honor of introducing our morning keynote speaker, Linda Blount. Linda is the president and CEO of the Black Women's Health Initiative, the only national organization focused on Black women's emotional, physical, financial health, and wellness. Please welcome at this time, Linda Blount.
Good morning. Thank you, Kyla. I am so happy to be here, and I just want to offer my thanks to Leader Sykes and to Senator Brown for your support. It is really an honor to be here actually to celebrate Black women's health, but also call out the challenges and the needs and the issues that are so important that need to be addressed. And I want to offer a special thank you to the organizers of the Ohio Black Women's Health Symposium, particularly Renee Harris, Closing the Gap. Just a little bit about my organization. As Kyla said, we are the only national organization focused on Black women and on the health of Black women and girls, and have been for 38 years. And we take a very broad approach, emotional wellness, physical wellness, and financial wellness, because we need all three of those dimensions to truly be healthy. Black Women's Health Imperative was started by Billie Avery when she got a MacArthur Genius Grant, and she brought 2,000 of her closest friends together to the campus of Spelman College to talk about how we should take care of each other, but more importantly, how we should take care of ourselves. So we are deeply rooted in self-care. And our areas of focus are chronic disease prevention and risk reduction. We are the leader in diabetes prevention in this country. HIV prevention, our programs have reached more than 1.8 million women. And maternal health and sexual health and reproductive justice. And of course, all of this gets undergirded by our policy work. We work closely with the Caucus on Black Women and Girls and the Congressional Black Caucus. And research. We translate research into actionable information for Black women, for community-based organizations. We published Index Us a few years ago, which was the first ever report on Black women's health based on healthy Black women. Because I don't know about all of you, but I'm tired of talking about what's wrong with Black women, because there's nothing wrong with Black women. And now, as you might imagine, we're really focused on clinical trials participation and research and what it means to create evidence for Black women and eliminating provider bias. So for the past 6 years, we've invested over $20 million in community-based organizations and federally qualified health centers to make sure that they're implementing evidence-based programs in communities across the country. But the past 6 months or so has caused us all to think again about what it means to be a Black woman in this society. Senator Brown talked about essential workers. In December, nobody thought Black women were essential, and now suddenly we're essential workers. But what that means is we get to work outside the home, be in front of often an unmasked and angry public, and then worry about what we're bringing back to our families, as he said. So this takes on a whole new importance for us and for all of you. And so this symposium really couldn't be more timely. I mean, as has been said, COVID-19 has highlighted the disparities and inequalities in health that we were all too aware of. I love that term, the great revealer, Senator Brown. The statistics are really shocking. I mean, we're at over 7 million cases and 200,000 deaths, but we do know that these are all underreported. The numbers of cases are probably off by an order of magnitude. And many researchers and scientists expect that the number of deaths reported are probably off by as much as 30%. So too many of us are never diagnosed, and too many of us die without ever making it to the hospital to be tested. And Black and brown people may make up as much as 45% of all deaths. So we've got this terrible, perfect storm brewing here. Our nation's abysmal public health response, the crushing effect of job and income loss, and the constant reminder that our families can be robbed of loved ones in the blink of an eye, that Black lives can be taken with impunity and no accountability. When we look at the potential for job loss, poverty, and what we call the deaths of despair, each year, that's about 89,000 excess deaths among Black people. And so looking at what we can expect with COVID-19, it gets to be really scary. Our predictive analysis has shown that if we don't have a vaccine, in 3 years, we could lose somewhere nationwide on the order of 400,000 to 600,000 Black people. And so to put it in really stark terms, in 3 years, that means every Black person in this country could lose a first-degree relative to COVID-19 or its effects. And of course, we have all the other health disparities to think about in diabetes and breast and cervical cancer, maternal and infant mortality, mental health, access to health insurance, and access to quality health care. But right now, the number one health issue for Black women is stress, and particularly racially mediated stress. And just to give an example, Black women have, on average, 15% more of a stress hormone called cortisol in their bloodstream. And we've got research going back to 1992 that looks at the experiences of racial discrimination and disease. So we now know that in Black women, racial discrimination is responsible for uterine fibroid tumors. It raises our inflammatory response, which raises our risk for diabetes and hypertension. And several researchers, including Fleta Mask-Jackson, have shown that experiences of racism lead to low birth weight babies and maternal mortality. So while we talk about these issues in public health, we don't ever put them in the proper context. And what we end up doing is blaming Black women. We blame Black women for being overweight, for having diabetes, for losing our children, when in fact it is the experience of being Black in this country that leads to these issues. And the people in my field are guilty of this, of talking about data and race in a way that would lead you to believe that it is because people are Black or it is because people are Latino. And I just want to make sure we all know, and I'm sure you all know this, but race is not a risk factor. Racism is a risk factor. And I'm so pleased that Senator Brown has joined others to declare racism as a public health crisis, because it is directly responsible for a whole host of diseases that we see in communities and the inability to take the steps that we'd like to address them. And so that's what makes this symposium so very important. We need many, many voices and many committed organizations and policymakers in and outside of healthcare to join together to fully understand what causes inequalities in health. We often talk about the social determinants that you all are familiar with, whether it's education or food deserts or neighborhood segregation, but rarely do we ask why these social determinants exist in the first place. We just sort of accept them as given. And since Senator Brown mentioned redlining, I just want to highlight that as one of many examples. People who live in redlined districts face a host of issues. It turns out that redline districts are actually warmer, on average 13 degrees warmer than non-redline districts. So if you're a pregnant woman, a Black woman, a Latina, going to work, you've got to walk through the heat in the summer, stand at the bus stop or take public transportation. You may not have air conditioning. And all of that has been proven to increase maternal health complications and complications from hypertension or cardiovascular disease. Redline areas also tend to be highly segregated. And we know, again, from the research, if we could end neighborhood segregation, we would actually end health disparities. That's how closely these are linked. So we need the courage to ask, to change systems and policies so Black women no longer suffer needlessly from preventable diseases or because they lack resources. We need to, and I was so happy to hear this, look at what we tend to do is look at people through the lens of a problem. But as Leader Sykes said, we can actually look at the problem through the lens of people's lived experiences, because it's only when you do that that you understand what can be done to actually improve health outcomes. And that's the lens through which the Black Women's Health Imperative takes to its work. This year, we joined in partnership with Closing the Health Gap, and we have committed to working together with Renee to form a broad coalition to focus on eliminating the structural barriers that perpetuate inequalities in advancing health promoting policies and advocating against those policies that would harm Black women's health, both in Ohio and across the country. We're going to focus on challenging the systems of care delivery so Black women are treated with dignity and respect and that they receive the quality health care that they deserve. We're going to ensure that Black women have the information, strategies, the tools, the resources they need to make the best healthcare choices for themselves and their families. And we want to establish and learn from best practices that can be applied in Ohio and across the country. There are some, but they don't often get replicated. And finally, we want to document the improvement in Black women's health and the reduction in health disparities. I am so proud to partner with Closing the Health Gap. It's organizations like Closing the Health Gap and leaders like Renee Harris that provide the roadmap for effective work at the community level and at the national level. And I couldn't be more pleased to support her work to ensure that the women of Ohio can live their healthiest and most productive lives in a society where they never have to wonder whether or not they're getting quality care or whether or not they're being treated with respect. What we want all Black women to know is that we are valuable, we are worthy simply because we did one thing, and that is that we woke up. So thank you very much for this opportunity to participate in this day, in this panel, and I look forward to the discussion. Thank you.
Thank you so much, Linda, for that incredible message. Again, for those of you who may have just joined us in the last couple of minutes, that's Linda Blount. She's the president and CEO of the Black Women's Health Initiative. Again, the only national organization that's focused on Black women's emotional, physical, financial health and wellness. So thank you so much for being an advocate for all of us in our community. Such incredible and important information for us to take with us there. At this time, we are going to go into our first panel of the morning. It is focused on physical health. And we will have each panelist introduce themselves. You'll have about 2 minutes for our panelists to introduce themselves, tell us a little bit about your work, and then we will go into our questions. I see we do already have one question in the chat, and I'm very excited about that. We'll get to that question as well. And then we have some other topics that we want to speak to our panelists about. So our panelists, and we can go in this order. If you'll take the time after I give your names, if you'll take 2 minutes to introduce yourselves, tell us a little bit about your work, and then we'll go into the questions. So Linda is going to stay with us for this panel. We'll also have Sophia Buggs, who's an urban farmer in Youngstown. We have Dr. Karen Cooper, who is with the Cleveland Clinic Women's Health Institute in Cleveland, Jasmine Long, Birthing Beautiful Communities in Cleveland, and Melba Moore, our Cincinnati Health Commissioner. So we'll start with Sophia. You have 2 minutes to tell us a little bit about yourself and your work.
Good morning, and thank you so much for this amazing opportunity to share my work and my vision with us Ohioans and folks around the globe. My name is Sophia Buggs. I am the owner and operator of Ladybug's Farm, which is located on the south side of Youngstown, Ohio. I am also the Mahoney Valley Food Access Coordinator, working with Healthy Community Partnership in the Valley. And I'm also someone who is supporting grassroots efforts. Most of the work that I'm doing comprises of gardening classes, cooking classes, and also working with people to have one-on-one tried and true plant medicine experiences to be well and to be healthy. One of the things that I felt that I should possibly share with you is a quote that I have often read to myself because as a Black woman doing a work that we have assumed to be very daunting, which is urban agriculture, which is gardening, has been one of the most life-saving experiences ever in my life. And that quote is from Fannie Lou, which says, "When I liberate myself, I liberate others. If you don't speak out, ain't nobody gonna speak out for you." So in doing that, I felt urban agriculture, gardening is a way to be proactive about your wellness. and your own personal self-care. And I know that being a part of what is called the heartland, a place where land is so lush and plentiful, having access to land is an issue, and having access to healthy, fresh foods is another issue. So thank you so much for this time and this great opportunity, and I'm looking forward to answering questions.
Thank you so much, Sophia. We'll go next to Dr. Karen Cooper. And right after Karen, we'll hear from Jasmine and then from Melba Moore. We'll just go back to back. Thank you, ladies.
Hi, good morning. Thank you, everyone, for this opportunity to be here. It's really wonderful. So my name is Karen Cooper. I am a family medicine physician that has been specializing in obesity medicine for the past 14 years, primarily at the Cleveland Clinic. And basically what I do is, or I should say, my intent has always been about preventative medicine. And a long time ago, I noticed the link between obesity and the opportunity to prevent a lot of the diseases that were associated with it, like high blood pressure and diabetes and so on, that we all treat a lot as family medicine physicians. So I thought that I would focus on that aspect to try and hit a number of metabolic diseases at the same time. I work with women primarily now. In the past 7 years, I've been with the Women's Health Institute at the Cleveland Clinic. Prior to that, I was with the bariatric surgical team, where I saw, all ages of the population. However, now I work solely with women. And in terms of obesity management, it's really critical to help women in terms of shame, to help them in terms of self-acceptance, to help them in terms of really understanding what it means to eat well, to eat right, to exercise regularly, and the impact that has even epigenetically on themselves and their offspring, to help pregnant women not gain excessive weight during their pregnancy, so that the reduction of the risk for them and the babies are much reduced. There is actually a lot that obesity management requires, and it permeates throughout all of healthcare. Everything that has been spoken about so far, the stress on Black women, the redlining, all the things that we are not able to have, I should say, or the lack of equity really impacts our health. And so what I hope to do when I see my patients, or when I talk to any woman really, in terms of obesity management, is to address the triggers that are surrounding it, because it's not just about the excess weight. It's about the things that are driving the excess weight, and how can we control all of that to have, a healthy outcome. Thank you.
Good morning, everyone. My name is Jasmine Long, and I work with Beautiful Communities. We are a doula collaborative organization whose mission is really centered on reducing Black infant mortality and mortality. I've heard a lot of women speak about it today, and the senator as well, talking about the fact that across the United States of America, we really have a very high infant mortality rate for Black babies in particular. In the state of Ohio, we know that Black infants, depending on which community you live in, may be 4 times more likely to die than their white counterparts. So our role really is to assist mothers with doulas, or as we call them, perinatal support specialists, who attend the labor and delivery, but who also stay with the moms from the time that their babies are, from the time that they're about 12 weeks pregnant until their baby's a year old. So we really take a holistic approach to serving mothers and being there for them. Linda said it so eloquently this morning that we understand that it's not race, it is racism. It is a toxic stress that comes along with being a Black woman that is leading to poor birth outcomes for our babies. It is a treatment that we're receiving in the hospital systems that is also leading to those poor birth outcomes. So our role is to provide that advocate who can help a woman advocate for herself, who can understand her body, and who can really have the birth that she would like to have. Our work is so critically important because we understand that COVID is elevating and highlighting a lot of things that have been challenges in our communities. Now we can see the exacerbated effect, particularly infant mortality. When I look at statistics in Cuyahoga County, for Latinx community, 0 infant deaths in the last quarter. For white women, their infant mortality rate went down during COVID. For African American women, our infant mortality rate has increased during COVID, and it really speaks to what Linda's saying. We are the essential workers. And even being home may not create a less stressful environment. As to what other women have experienced, that being home, not having to travel to work, those are kind of things that are reducing infant mortality in other communities, but we're not necessarily seeing that. And there is a wonderful question from Michelle Edison, who is very adamant about the work being done in Mahoning County and understanding that there's only one birthing hospital there. I think what you can do, and again, we have to talk about what real and true equity means, what we're going to put our resources behind, how we're going to fund work that really has an impact. Then we're going to put money into providing doulas for every woman who is attending a hospital birth. I think it is so incredibly important that women are able to have access to a doula, to be there, to be that support system, so that even if the hospital, you only have one birthing hospital, so they don't have many options, that they still have the opportunity to learn and educate themselves and understand what their birthing process is, and if they feel that they can advocate for themselves. That is so important to ensuring that women are able to have a healthy, safe birth. We've seen close to 800 families in our 4 years of existence, and we have a 99.2% infant survival rate. So we know that women who are able to receive care from doulas, from Black women who look like them, who come from the same neighborhoods as them, are able to have a safe birth because they see themselves in the women that they're working with, and we provide exceptional care. So I'm excited to be here with my colleagues today, and I look forward to learning more and answering any questions that may come up.
And Commissioner Moore, we're ready when you are.
Good morning, everyone, and thank you to Senator Brown, Representative Sykes, and Renee Mahaffy Harris. Thank you, and allowing me to be a part of this illustrious panel. You know, as I was listening to each of you, I kept saying, look at the beauty, the essence of beauty that's before us this morning, to talk about what we know in our spaces and how it's so impactful and how we all can learn. And I am thankful, very thankful and grateful to be a part of this panel so I can learn from you. As many of you know, that I am new to the Cincinnati area. However, I served as health commissioner for 17 years in the city of St. Louis with the longest serving mayor. And coming to Cincinnati, I found that the two cities are similar in that they're river towns, and some of the same health conditions are very prevalent, and they have been mentioned here this morning. Political will. It is the political will to be deliberate and intentional. We must seize this opportunity that is before us now. We have seen through COVID the challenges, the long-standing issues that we have been talking about, have been advocating for. But we see, and others see, whether they choose to believe it or not, African Americans are disproportionately impacted and affected by COVID-19, as well as chronic disease. When I think about what I do as health commissioner in the city of Cincinnati, it falls on 3 areas: access to care, maternal and infant health, and mental health. Access to care, reducing the barriers for Black women related to health and increasing access to quality services That's oral health, vision, mental and behavioral health, and health screenings. Maternal and infant health. How can I do this unless I do this in partnership? And I want to take us to what we have seen, the deliberate and intentional actions of systems through COVID. Hospitals came together to work on COVID. And my comment is that was the political will to do that. And that's what we must do moving forward in addressing the health conditions of Black women, of Black people. So that means collaboration, partnering to improve the chances of Black mothers having full-term babies and decrease infant mortality. You've heard the term essential worker. When the governor shut down the state of Ohio, the stay-at-home order, our essential worker, those are the people that kept the businesses going. And they were greater impacted by COVID. I want to tell you a story that's truth. A young woman shared with me, and she told me I could tell this story. She's a mom of 3. And 6 years ago, she went to the doctor and she was having some challenges. Now, this doctor had been her doctor who helped deliver her children. And the comment they did, took some exams, took some blood, and just told her everything was okay. But she kept having problems, female problems. I think, Linda, you talked about fibroid tumors. Nonetheless, this young woman suffered for 6 years, not knowing, just making it every day, getting up, getting her children out, coming to work. And she knows me a little bit, and she said, you know, I recognized I was wearing a lot of black because I was scared that I might stain myself. She's been released from that worry because she did something that I believe all of us can and do. She exercised her courage. And she said, something about this just isn't right. Let me make another decision. And she spoke up. She asked a question, which led to other questions. Now, mind you, she went from a male provider to a female provider. And that female provider got her in immediately and shared with her what she needed to know and gave her some options. And she acted upon them immediately. That's how serious it was. And she was given good news yesterday that it wasn't cancerous and that there's some things that she can do moving forward. I tell that story because how many times have we heard and do we know that that happens and the outcome might not be the same because of fear, because of stigma, or because of the lack of information or the lack of knowledge of how you should proceed. So as we take this time today and next Saturday, the visual that I have is a hand reached out to lift up. We must be deliberate. We must be intentional in what we do. And we must press forward. Sometimes I tell you, I wouldn't necessarily like the word demand, but demand is what we must do. Demand through advocacy and changing policy, but working collaboratively to address the issues that impact our community. I look forward to listening and learning more and sharing more with you this morning. We can do this. We are better than this. And women make up over a little bit more than half of the population in Ohio, 51.1%. We can do this. Together, we can be better. Thank you.
Thank you so much, Health Commissioner Moore. You're right. It's time for us to demand better. And that's why we showed up early on this Saturday morning to get ready to equip and empower ourselves to demand better in each of our communities. So we're starting with our panel. We're going to have some incredible discussion around our health and how we do empower ourselves, how we know how to ask the right questions, how we know how to properly feed ourselves, as Sophia mentioned. So we'll go right into it, and it's open to any panelists who'd like to answer. If each of you would like to answer, that's fine as well. We do want to be mindful of time. So if we get each panelist answering, we just ask that you kind of keep it a little brief. But our first question is, based on your area of focus, please share with us what you see as the 3 greatest barriers to improved health outcomes facing Black women, and also how you're working to address those barriers in your community. We have anyone who might want to go first?
I'll go first. I kind of briefly mentioned it in my opening. Access to care, mental and behavioral health, access to nutritious foods, but maternal and infant health. Those are the things that we're working on. We have 5 focal areas here in the City of Cincinnati Health Department, which includes access to nutritious foods, access to quality healthcare services, infant mortality, mental and behavioral health, and lead poisoning. We still have an issue in our community as it relates to lead.
Ms. Melba really hit the...
Sorry, go ahead.
I'm sorry, Ms. Melba really hit the nail on the head, really talking about the fact of that women have to trust their providers. And I think that we have historically been so disenfranchised, and we understand that we haven't received the best care in hospitals. And so we have to build that trust again so that women are comfortable sharing their stories, knowing that if something is wrong with me, then I have the right to go to another provider. I don't have to just trust that one doctor who told me nothing was wrong. I have the right to have a second, third, 4th opinion because I know my body and I know when something is wrong with me. So in addition to all those things that you linked, I think that some of those issues can be solved by, again, empowering Black women to advocate and be advocates for themselves.
I do feel that affordable healthcare is necessary unless we have expansion of Medicaid throughout all of the states, that there's always going to be an issue in terms of the access to healthcare. Racism, of course, as we've all said, I think has been a huge problem in terms of what it produces health-wise in the individual and all the diseases that it predisposes her to. And poverty and food insecurity. Of course, with poverty, there's lack of access to healthcare as well as a myriad of things. And then with the food insecurity, again, we're setting people up for all types of chronic illnesses, acute and chronic illnesses that need to be dealt with. So I guess what I should say in terms of my practice, since all of these aspects affect obesity, promote it perhaps, what I try to do is work with women in terms of what the triggers are, see where I could connect them socially to help some of these disparities while we're working on preventive health care.
And Kyla, I'll just jump in. One of the things that really concerns me now is that COVID-19 is keeping women away from their doctors. And so they're not getting their mammograms, they're not getting their Pap tests, they're not getting their well woman visits. And so my concern is, in another 6 months or so, we're going to see more late stage cancer diagnoses. When women have lost their jobs, don't have employer-based health insurance anymore. And so that may keep them from getting care. And of course, particularly around COVID-19, there's all this research going on, clinical trials for therapeutics and vaccines, and we are not included. And that concerns me enormously, that we are going to come up with a vaccine that will be approved, but it may not be as effective for Black people. And we saw it with COVID-19 therapeutic, dexamethasone, which turned out it wasn't as effective on African Americans as it was on the white population. Well, there were no African Americans involved in any of the trials, so not surprising.
So historically, many people of color have been detached from land, and you all have shared a lot of information that we're all clear about it, and we're very clear about. I mean, we really can't choose which one, right? There's so many issues that we are absolutely challenged with, and so my working in land, not necessarily from a bigger organization, but individually, that is absolutely the thing that saved me, was having access to land. Having access to land not just helped me with my mental clarity, but it also helped with my physical clarity. And it also sparked something very interesting that I didn't realize that we all possessed, an actual real relationship to the land. And I know that we're talking about things that are affecting us. But when we really go even deeper and we're talking about access to fresh foods, the first thing I'm always concerned is who has access to land and seed and the right education to be as prolific in our future green space that is absolutely coming. And I know that we're in a epidemic and our arms are up in the air about so much that's happening. But at the end of the day, green space and having access to really good land to grow for yourself, for your family, and your community is another thing that is something that we absolutely should be concerned about. Because as a grower in Ohio, there aren't many brown faces, there aren't many women, there's not much diversity in that aspect. And we all know that without having access to our own spaces, we aren't able to be as forthcoming. We are not able to move about in the world. So the other thing that I wanted to share was that issue around maternal and child health, right? And so that comes back to the other act thing is we know that's a problem and those are the barriers. We want access to care, but at the same time, there is something to be thought about when we are putting our health in the hands of other people to think enough of us. So breastfeeding is what I think of. How many of our moms have the high quality care that they need to remind them that breast is best? Having a system that supports breastfeeding, having a system that supports breastfeeding that supports the entire community. So that's another thing, not necessarily to make gardening, breastfeeding, or these natural ways to trump others. However, if it comes down to who has access to something without owning your own, you might not have a whole lot of choice at choosing what something's available. And we do live in a world where sometimes everyone else's good access is not exactly what you feel is good. For me, what's good is what growing from the land and how I can access those medicines first. And then I'm able to take it to another level if my medical care is not working for myself. But having my own self care through radical self love and access to land absolutely helps with physical, mental clarity.
I just want to add on, because Sophia, I think you really touched on something that is very important, and I think we can't let this be missed. When you're talking about breastfeeding, our work at Birthing Beautiful Communities is so transformational because we have to take it back to slavery. And I think what we as Black people haven't done is really grieve all the losses that have stemmed in our community from slavery. We've traditionally breastfed everyone's babies. We've traditionally been the midwives. We've traditionally been in these spaces, but for other people, not necessarily being able to give the same care to our own children. And so we have a whole team of lactation counselors because we are Black, myself included, because we are Black women telling to other Black women it's okay to breastfeed your baby. It's not going to be painful. There are so many myths that exist in our community that we haven't even worked through because Big Mama said this, 30 years ago. And so my mom did this and her mom did this. And we've never moved past why that did not happen and really not grieving those losses of being forced to breastfeed your master's children while your own baby's laid by you. So, I mean, those are the kind of things that we have to process. And I think that there's so much healing that has to be done in the Black community
Yes.
that really gets to that true health. So thank you for bringing that to the table.
Thank you.
Thank you. Oh my goodness. I'm probably speaking on behalf of everyone attending and watching and listening to this right now. I wish we had, 6 more hours to add. We have so much great content here, so much insight that you all are providing to us. And there are so many layers when we talk about this work and when we talk about improving health outcomes. As you've all spoken to from your different areas of expertise, thank you so much for sharing that. I've tried to highlight a few things in the chat so that our attendees can just take that with them. For those of you who've already shared your email address or your social media handle, thank you. For those of you who haven't, please share that in our chat so that those who are attending virtually can reach you after this and get their questions answered and just connect with you to learn more beyond our time together. Again, I want to emphasize this is why the work of the Health Gap is so important. The work that Renee Mahaffy Harris is leading there, helping us to heal our bodies through food, learning about the Eat Right and Do Right programs, how we can serve our families better with what we're eating, how we can advocate better for ourselves as Black women in our community, how we can ask those tough questions and the questions that maybe we hesitate to ask when we're with our medical provider, because they move quickly and we have to advocate for ourselves. That's one thing that just continues to rise to the surface today. So I hope if you're listening and watching today, you know that and you're empowering yourself for that next doctor's appointment that you have or that next piece of medical advice that you're seeking out. We're going to move to our next question. So we've talked a lot about some of the issues we are facing as Black women when it comes to our health and how we improve those outcomes. Let's talk about the solutions and how we get to better outcomes. So for each panelist, again, if you wouldn't mind keeping it to about 2 minutes and we can go down the line. I'll give you kind of who should go first and how we'll go down the line on our panelists. For this particular question, let's talk about successful programs and initiatives that currently exist. So what are some that you're seeing in your city or community or your state? And then how can we support those? And what can we do to help expand those successful solutions that currently exist? We'll start with Sophia, and then we will go to Jasmine, and then Linda, and then we'll hear from Melba, and then Karen Cooper.
So currently we have a few different types of initiatives that are happening locally here in Youngstown, Ohio. With me working with Healthy Community Partnership, which is a body of partners that are committed to making sure that food access, parks and green space, and active transportation is the things that are supported the most, because we know that those are some of the challenge that many of our residents are experiencing. But also too, Black Period has a walking wellness accountability that happens at least once a week, because through Girl Track, which is we also have a Youngstown Girl Track site, highlights the fact that if you are able to get out and walk at least 30 minutes twice a week, that you are able to lower those challenges and support your body in ways that you wouldn't even think could happen by doing something as simple as walking. And I know for many of us, just the thought of doing one more thing that you just don't have to do is an issue. But of course, with me working as food access coordinator with my small farm, I'm always sharing with people how gardening is a total package. I mean, really, you're breathing really good air, you're making choices with other living beings and sometimes other people if it's community garden spaces. So I really do think there's more infrastructure that needs to be put in those areas. And I know that I keep emphasizing land, but this is Ohio. Ohio is agriculture, and there needs to be more women, and there needs to be more women of color, there needs to be more Black women who are working with the land, but we need access to these spaces. We need access to seeds. We need access to things that help us build from land spaces in our own community so that we're able to thrive and to move about in the world beyond, like I said, what others are suggesting is good for you. We don't have a lot of time to talk about the layers and the many of challenges from historical context. However, if we move forward and say now what's now needed, we need spaces where we can heal ourselves. And sometimes those spaces do not include other people. And so having access to spaces like land for us to do this kind of work is paramount.
Thank you for that, Sophia. I can't highlight enough the importance of having that doula. I think our work is critically important. We are in 2 counties. We're in Summit and Cuyahoga County. So that I'll let you other ladies speak to all the other incredible initiatives happening across the state. But there was a question that was asking, what can we as Black women do to advocate and ensure that there'll continue to be affordable healthcare options to us? I think we do it. We continue. We consistently show up. We are the Democratic base. We show up and we vote and we do what we're supposed to do. And I just hope that we don't get discouraged by things that happen and we continue to advocate, that we continue to force and push and advocate for policy change, so that we can really see some of this stuff. It goes way back to that question from Mahoning County of what can we do to increase access and ensure that our moms are protected. We have got to have the money to support programs and policies that really bring about true change.
Yeah, and I just have to echo Jasmine and Sophia. I mean, it's not a program, but the thing we can do is vote. Absolutely vote, get out and vote and understand the issues, understand where the candidates are on these issues, and then hold them accountable after the election. That is critical. And I'll just mention, we've got Black Women's Health Imperative has a chronic disease prevention program that's excellent. We're about to roll it out digitally so that every woman can have it wherever she is. She can get coaching, she can get advice, all kinds of great information. And I'm so happy to hear Sophia talk about the land, because it's a way of being able to connect women to really good food and understanding how good food matters to their health. But the number one thing on every woman's agenda right now, vote.
Did we hear from everyone? I think Melba Moore, if you'd like to contribute as well, talking about working.
Okay, thank you. What I found through this COVID pandemic is the connection, engagement, education, and empowerment, and seize the opportunity. And working with the Health Gap has really opened the doors to reach the communities that we need to serve. For example, so we knew that we needed to do when testing became available. And we worked with the community. I worked through Renee with our community partners. And we had a great success in getting a lot of people tested and also educating them on the why. And that's when Renee had her platform, her virtual town hall meetings. It's so important that we connect with one another to engage the community. There was another example of how people could go about getting tested, but I stand on what we did. We worked through one another to get the community engaged and involved to plan. And you have to educate on why it's so important. We listen to our young people. And then the other thing, I think someone mentioned clinical trials. That's our next avenue of where we're going to really hear from the community, educate our providers, our medical community, but hear from the community as to the why, and then provide them with education information on the efficacy of the evaluation component, why it's important for us, people of color, Black and Brown communities, to participate in those trials. So education through engagement. Thank you.
Thank you so much to all of our panelists for answering those questions. We do want to go ahead and move to some of the chat questions. We do have one from Sheena Barnes in Toledo, and she asks, how can we increase more Black doctors, therapists, directors of healthcare, et cetera? And one or two of our panelists, if you have any insight around how we help increase the pool of Black doctors, we'd love to hear from you.
So we often look for jobs that we see. I apologize. And one of the things, this is really quickly, I want to say that we have to be mindful in the language that we use with our children. So, right, we can't say when our child is struggling with maybe mathematics or science, well, I was bad in that too. So they just internalize, well, we're just not good at math and science. So we really have to, one, encourage our kids, help them, and encourage them to be a little different from us, right? But then we have to educate these providers in providing education that is not biased, and really allowing ourselves, allowing people that look like us to have the chance to actually excel and succeed in these kind of programs.
I think another thing is to get caught doing the things that we love in the space with our children. They need to see that we too are very excited about our own bodies and our own health and our own well-being. It is the hope that they see within us that they become our future. If we aren't creating those conversations with our own babies, we won't make it. We have to make it a point to tell our children, my knees are hurting, my hips are sore, and mommy is not well. We have to be honest, and we cannot just only have these adult conversations with the people we want to complain to, like our politicians, but we need to do this with our children because they are the future voters. They are the ones that create this kind of change. And I do not want my daughter to choose a profession based on struggle love. I want her to choose it out of pride, she comes from a very strong, powerful ancestry that has always made sure that women are kept well. This is what we need to be able to plant into our children. And we need to make sure that in our institutions, specifically Ohio, that we have more agricultural-based information, even if those educational based systems aren't specifically ag, but some of the stories is about land and the seed and about healthy eating and healthy food, like meshing it all together because food is everywhere and it touches all of us. And many of us wouldn't even have homes without land. And so in our education system, we need to make sure that they too are providing the right diverse information and the new information around multiple intelligence and all the myriad of learners on how to make the right steps to being who we need to be for our tomorrow. And that is by way through our children. But if our brown girls keep watching us die and not say anything to them ourselves because we feel we're protecting them, then they too will do the same thing that happened to us. They'll be forced to just go into the workforce to do the thing that's going to bring them the most money, as opposed to the love and the integrity that they want to provide in their own communities.
I also feel that we need a lot more mentoring. For people to get into the health field so you can have more Black doctors, more Black nurses, and so on and so forth. The other thing is I am amazed at, we've been having an obesity epidemic for at least 20 years, but how many dietitians, nutritionists are Black? We tend to push our kids into nursing and other aspects of the health profession, but why are we not pushing them more into areas that are going to be more beneficial for the community, at large? And then organizations really need to be intentional about underrepresented recruitment and retention. So unless we get all of those factors connected, along with what everyone else said on the panel, we're still going to continue having, a lack of diversity in these areas.
Thank you all so much. It sounds like we're trying to break those generational curses of not having those conversations with our children. That is such an important element as we look to change and shift our perspectives and shift those outcomes. We do have to include our children. So thank you so much for highlighting that, as well as that mentorship piece. We have to encourage, those who are Black, and especially as Black women, if we have those resources to help mentor the next generation and emphasize the importance of us continuing to grow the number of Black doctors and Black healthcare professionals that we see in our community. Many times that's built out of relationship and advocacy. And so, yes, it is on those professionals, but it's on all of us as well as community members to see how we can help share that information and help also serve as advocates. So many amazing things shared. So much incredible information for us to take with us. Please scan the chat if you're joining us. Again, welcome to the inaugural Black Women's Health Symposium, our virtual edition. This is a part of the Black Women's Health Movement powered by Health Gap. And so we are so thrilled and grateful to have you all in joining us today as we equip and empower ourselves to improve our physical health and also to improve the health of our entire community. And so we just heard from our incredibly esteemed panel of experts telling us about how we can advocate better for our physical health. And now we're going to go into a workshop. One theme that kind of arose during our time during the panel was, how do we better advocate for ourselves as patients when we are speaking with our healthcare professionals, when we have those appointments, even when we're doing Google searches. We all search for things when something's wrong, we're looking for things. So how do we just really empower ourselves to be prepared when we're speaking with our health professionals? And so at this time, I'd like to introduce Vanisha Hampton, and she's going to facilitate our virtual workshop called Getting the Most Out of Your Doctor Visit. And Vanisha is a certified community health worker at Celebrate One in Columbus. Let's welcome her at this time.
Good morning, everyone. Thank you so much for having me. Like the moderator Wood said, I am Vanisha Hampton, a community health worker with Celebrate One here in Columbus, Ohio. At Celebrate One, we support families that are parenting children under 12 months or expecting a child. And we just support them in getting connected to the resources and services available to them in their communities. So with that, I work a lot with moms and helping them to advocate for themselves in medical spaces and other, places where they may not have a voice of their own. So like the moderator said, I just have a few tips for anyone joining in. Women specifically to advocate for themselves in that doctor's office space. And the first thing I will say is to plan ahead. Your doctor's appointment starts before you ever get to the office. You want to keep a notebook or a journal is what I recommend of your symptoms and questions that you may have for your medical professional. You want to write down your concerns as soon as you think of them, right? You don't want to wait until you get there to try to scramble to remember all of the things that you wanted to say. How many times have you gotten to the doctor's office and it wasn't until you got in your car to go home that you were like, what was that I wanted to ask? Or, darn, I remember I was going to say this or I was going to ask that, and then you just completely forgot. So it's important that you take with you a journal and write things down prior to ever having your appointment. You write them down as soon as you think about them so that when you are in that office space, you are equipped, with all of the information that you need as far as symptoms or questions that you wanted to discuss or share with your doctor. And then also to determine what you want to get out of your appointment, right? So is this a preventative or well checkup, or are you looking for a diagnosis or to modify a current or existing treatment plan? Know those things going in and then gear your conversation around that goal. If you're looking for a diagnosis, be sure to have your symptoms written down, when they started and all of the information that's around them, right? And whatever treatment plans you have already used, right? So if you've already tried Tylenol or, whatever, make sure you have all of that information ready for your healthcare professional so that they can assist you as best as they can. And if you're looking to modify a current treatment plan, then be prepared to share with your doctor what didn't work and why. Don't just, I didn't like that. Get some really specific information about why that treatment plan isn't working for you, what you think would be better, or what you all could come up with collaboratively to have a better outcome for your treatment plan. And then also you want to take notes while you're there, right? That same notebook that you had going in, with your questions and concerns, use that to take notes so that when you get out of the doctor's office, you're not scrambling to remember what it is you guys discussed, right? You get home and you're like, what did he say? I know he said something about this or something about that. And then you're, kind of lost for what you should do next or next steps are. So make sure you take that same notebook and you're writing down, what the doctor said. And then don't forget to ask for clarity, right? Sometimes the office visits go so quickly and feel so rushed, or they're using medical terminology or medical jargon that you don't quite understand. Don't be afraid to slow your professional down. Say that you don't understand what's going on. Say that you don't know what that term or word means. It's okay. That's a safe space for you to say, I don't understand what you're saying, or I don't know what you're asking of me, or what this information you're giving me means. Sometimes we just get so overwhelmed with what the doctor is saying that we just nod, yeah, I understand, when in fact we really, really don't. And also use that time to be honest with your healthcare professional. Sometimes we want to hide or deny things that we're doing, or parts of our lifestyle that we may not think that our provider will agree with, but really you're just doing yourself a disservice. So if you are, if you're diabetic and you know that you're not eating the right things, be honest about those things. Or if you are experiencing pain, don't dumb it down for the doctor. Be very clear, be very honest, be very open about all of the questions that are being asked of you, and share the things that are pertinent to your health. It's not a time to be shy or embarrassed. They're not there to judge you. Know that they're there to help you. So make sure you're using that time to be very honest about your lifestyle and about the questions that your provider may be asking you. And if at all possible, and as often as you are comfortable, or as much as you are comfortable, bring a support person. Bring somebody with you, that knows you, that knows what's going on with that situation, and that can sometimes step in or advocate for you where you may be unable to do so for yourself, right? Oh, I'm sorry, it says turn your camera on. I didn't realize it wasn't. Oh, hi everyone. Sorry. Oh yeah, I'm so sorry about that. I didn't realize my camera wasn't on. But yeah, bring a support person, bring someone that you trust and that you feel comfortable with to step in and advocate for you where you may not be able to do so yourself. So maybe like a spouse or a friend, or even help. I support my clients and families in that way when they're comfortable all the time. And sometimes, when I can see that they aren't comfortable in sharing that they don't understand, I can say, hey, well, wait, what does that mean exactly? Or how would she go about doing that in a more practical way? Or sometimes when the doctor is going on and one of my clients can't get a word in, and I know that there was something that they wanted to ask, I can step in and say, hey, didn't you mention you wanted to say this or that? And so having a support person there with you can really help you in those areas. So as often and as much as you are comfortable, take somebody with you to advocate for you if you can't do so for yourself. All right, so I don't know if there are any questions or anything like that, but yeah, those are really just key points that I think is vital to having a successful doctor's visit and getting the most out of that appointment. You want to plan ahead, start before the appointment ever even begins. You want to determine what you want to get out that appointment before you ever even get there. You want to take notes and bring notes, and you just want to share openly and honestly with your provider.
I would ask one question, Vanisha.
Yes,
thank you
ma'am.
so much for all this with us. One question for you, as we've all been in the predicament where we've gotten to the doctor's office, things can move really quickly when you're in there. You're working quickly with a nurse or maybe an assistant. They come in, they do all of your kind of administrative stuff, and then the doctor comes in and you really have to be on top of it. So what are some things that we can, I guess, just keep in mind in that moment? Because sometimes it feels like they're moving fast and you don't want to inconvenience them. You know what I mean? Like you don't want to
I think you should not even have that in your mind. trying to inconvenience them. They're there to provide a service for you. So when you go in there, you can't go in, with that shy, timid mindset. Oh, no, I don't want to be a burden on them. This is their job. This is the service that they're being paid to provide for you. So go in, firm and make sure that you are heard and what your complaints or issues are. It's not an inconvenience to them. If your appointment takes a little longer than they scheduled for, then that's not your issue to make up for. It's they'll have to accommodate for that somewhere down later in their schedule. No, you don't want to be completely dismissive to the schedule and the time frame, but you also don't want to be so passive that you leave without having accomplished anything, or you leave feeling like you didn't get your voice heard or your problem resolved. So then you're like, oh well, and then this continues to compound on, and then now you have a bigger health issue in the end because you didn't address it at this initial appointment.
So as a doctor on this panel, can I speak? Can I say something as a doctor on this panel? I think what Vanisha said, everything that she said was really good, really be prepared, take a notebook, write notes and things like that. And yes, sometimes there is a time limit, that can't be negotiated. However, if you at least have that one thing, maybe, so give it about 1 to 3 items, but particularly that one issue that you really want discussed, that's what you make sure that you have in front of you to discuss with the physician. The other thing I tell my patients too, because a lot of patients get really anxious in terms of that, patient-physician relationship. And I say, just pretend you're in Nordstrom or any other shopping center. The same rights that you feel you have when you're shopping, that's exactly what it is when you get to your doctor's office. So if you think there's something that wasn't well explained, you owe it to yourself to ask that question until you get it. Just the same way that you would not let a bargain go, you have to really apply that to yourself in terms of healthcare. So that's all I wanted to say. Thanks so much.
No, I completely agree with you, doctor. That's why I was saying kind of determine what you're expecting out of the appointment before you get there. Have a goal in mind. You can't, obviously you don't want to go into your doctor's appointment and have a laundry list of things. We know that the doctor can't address every single ailment you may be having, but if you're there for a prenatal appointment, and you've been having this pain or this issue since your last appointment, then you want to share that, just going in knowing what you want to get out of this appointment.
Yeah,
I think there's a way to optimize your time.
Typically what we experience is that when the patient is leaving, just before they open the door, they'll say, you know what? And that was the one thing they probably wanted to talk about in the beginning, but typically wait until the end. So you're right. If you're really prepared, if you think about that thing that's really bothering you, that's what you want to get out as soon as you get in the door.
Absolutely.
Thank you so much for all of that. I wanted to share too how in my own personal experience, having a baby helped me advocate better for myself because my doula encouraged me to actually have a birth plan. She asked me to write 3 birth plans, one for my family, one for the birthing center, and one for the hospital. And that birthing plan really got me to configure that my past experiences with journaling is something very important when it comes to even advocating for myself in the hospital. So thank you so much for sharing that very simple, basic routine that we can have within our own selves to have our own medical journeys, to be able to look at the things for ourselves on what things are most important and what's not. And when we're most comfortable with having those conversations with ourselves and our families, we can advocate even better in hospital. So I love the idea that when I was educated from my doula to write a birth plan for myself, that, you know what, I think I should always have a plan written before I enter an institution like this. So thank you for so much for that share.
Yeah, I completely agree about the journal. It's so important to write the things down that are bothering us as soon as we feel it or think it, because then when the doctor says, when did that start? I don't know, maybe 3 weeks ago, and it's really been 3 months ago. But if it's not something that's like persistent, it kind of escapes your mind, and then you don't really know when it started or how to describe the pain. But if you keep that journal, that's strictly for your medical or mental health or whatever, it really will help you to advocate for yourself in that doctor's visit or that office space.
Thank you so much, Vanisha. It sounds like preparation is key. Just making sure you're journaling, making sure you're prepared when you go to your doctor's office. Have those 1 to 3. That number one, there's always a number one top
absolutely.
of mind we have to have that we have to get that answer to. And maybe you have a couple of backups that Dr. Karen mentioned. Have 1 to 3, but have those in mind before you get in that room so that you can maximize the time that you have available. We appreciate all the tips that you gave us today so we can be ready for those next visits. And to all of our physical health panelists, thank you all for your time and expertise today. And we're going to shift our focus now to community health. And so we have some more incredible panelists who are going to join us to discuss how we can improve the outcomes for our entire community as Black women. How do we lead that effort? So I'll introduce you. I'll give you the names of our panelists and where they're coming from for us virtually this morning, and then I'll give them again 2 minutes for each panelist. Please tell us a little bit about yourself and your work, and then we'll get right into our questions. So for our community health panel, we have Reverend Marcia Dinkins joining us with Black Women Rising in Mahoning Valley. Jan Michelle Kearney from our Cincinnati City Council. We also have Gina McFarlane L. with 5 Rivers Health Center. We have Donnie Miller with the Neighborhood Health Association, Meredith Shockley Smith with Cradle Cincinnati and Queens Village. And we also have Charletta Tavares, Primary One Health. And so if we can go in that order to our panelists, in just 2 minutes, tell us a little bit about yourself and your work.
Sure. Good morning, everyone, and thank you for allowing me to be a part. I'm Reverend Marcia Dinkins, founder and executive director of Black Women Rising. I was in Youngstown, Ohio. I am now in Dayton, Ohio. But the work that I do a lot of work around protecting and defending healthcare, the social safety net programs such as housing, environmental racism, climate change. And all of this is centering the voices of Black women because all of these things are connected to our lived experience. I do a lot of work around child welfare and working towards decoupling the narrative that child welfare is really welfare for our children. And it's in the best interest of our children. And I also do a lot of work in the community, organizing, engaging, mobilizing women directly impacted and indirectly impacted around health issues and health outcomes in our communities to organize as well as influence policies and educate legislators on those issues that impact us the most, especially when it comes to Black health. Thank you.
Hi, everyone. I'm Jan Michelle Lemon Kearney. I'm a Cincinnati City Council member. I've been on council about 6 to 7 months now. I can tell you it's been a really whirlwind time. There are a lot of issues before us. I'll just name a few things that we're working on. As you know, as unemployment rises, gun violence rises. So the gun violence in our community is just a major issue for us, including domestic violence. The gun violence issue has become, and always really has been, but has become even more personal for me. One of my son's friends is really grieving now. His younger sister accidentally shot and killed her older sister, and the funeral for her was yesterday. And just to see the pain and the shock, and I mean, it's just a really horrible time. And I can tell you, accidental shootings by children are up 30% during this COVID pandemic. So that's the gun violence is something everybody's looking at and looking for solutions. Other things we're working on, because of the extensive research provided by the Center for Closing the Health Gap, and also following the example of Senator Sharon Brown in the U.S. Senate, several of us on City Council have declared racism, systemic racism, as a public health crisis in Cincinnati. And so with the leadership, and you just heard her a little while ago, Dr. Melba Moore, our Cincinnati Health Commissioner, and also Renee Mahaffy Harris, President and CEO of Center for Closing the Health Gap. We're forming a task force of leaders from many organizations, NAACP, Urban League, National Action Network, the African American Chamber of Commerce, the Cincinnati Medical Association, and I'll be here all day naming all the folks who are helping. But we're forming a task force to see how are we going to address this issue. I mean, systemic racism permeates every facet of our lives. And so how are we going to actually attack it? So we're working on that. And that's huge, but really excited about the work and the support for actually making this go forward. We're also working on increasing home ownership, especially in low income communities. That home ownership is a way of building wealth. It's a way of building generational wealth. It also helps with physical health, mental health, and there are studies that even show home ownership helps with improving educational attainment of our children. But many Black and Brown communities, low-income communities, because of historic redlining, we've been left out of home ownership. Another issue that's related to that is many low-income homeowners have lost their homes because they couldn't meet housing code violation demands. And so we're working on that to keep homeowners from losing their homes because of housing code violations. And that's kind of an ongoing struggle. Also working with Black businesses. One study showed that in January this year, there were about 1 million Black-owned businesses in the United States. By April of this year, 440,000 of them had closed. So we know COVID hit, a lot of businesses struggled, but Black businesses had the hardest time getting those federal dollars. We didn't have those connections with banks. There were other reasons as well, and so a lot of Black businesses just could not stay open. So we do, one of the things we're doing is starting a series of certification webinars to help Black businesses get more contracts. We also do something called #Cincy Buy Black Thursdays, and we say, buy Black every day. Support all of our businesses, our small businesses, and don't forget our Black businesses. And my website has a Black business directory, because people go, well, who are the Black businesses? How do I find them? We're trying to make it easy for you, and it's all free. Also, with other council members, we're working on more jobs for youth. And so we're partnering with our Hamilton County Juvenile Court probation system so we can help youth, not stay in this criminal justice system, get out of this criminal justice system and get them into jobs. And we tell the employers, no matter what job you give them, they have to, at some point, sit in the C-suite. Let's let them see what leadership is like. Let's let them see how decisions are made. We want them to really learn about the industry and the job, and not just do the most menial part of it. And we're also in conversation with the Center for Closing the Health Gap about starting a Black women's breast cancer support group. And I love what Vanisha Hampton was just talking about in terms of taking someone with you to the doctor. I'm a breast cancer survivor, and I can tell you, when I sat in the doctor's office, oh, am I running out of time? Okay, real fast. When I was in the doctor's office and, hearing all this information, I mean, I was kind of really just, zoning out. But, I had sometimes my husband with me, sometimes friends with me, and they took notes. So later I could say, what did she say? What did he say? So it's really important to have a partner with you. So we're going to talk about that. I also love that, Linda Blount was talking about how a lot of our red line communities are physically hotter. They're 13 to 15 degrees hotter. And that it hurts our health even more. One solution is, we need to plant more trees. And so we're talking about, things like that. And then finally, just the last thing that we're working on is there's a major street in Cincinnati, Reading Road, that goes from downtown to the end of our city, goes through a lot of predominantly Black neighborhoods. And we're working on having it renamed President Barack Obama Avenue, because we said we need to keep that message of hope and change alive and well always. So thank you for inviting me. Thank you, Senator Brown, Aaliyah Brown, and Mahaffy Harris, and everyone.
Good morning, this is Gina McFarland, and I'm the CEO of Five Rivers Health Centers. We're in Dayton, Ohio, within Montgomery County, and I've been the founder of Five Rivers Health Center. We're the 9th largest federally qualified health center within Ohio. A federally qualified health center provides comprehensive care for patients regardless of their ability to pay. You're fortunate to have 3 CEOs, 3 powerhouse CEO women who are all a part of the FQHC world. And what we do is we try to take care of everyone. And from the standpoint of, we take them where they are and we try to take them to a new level of health. And so we do that by lots of different programs, being a one-stop shop for all of our patients. And at the same time, we're also providing an environment for them to grow into other different areas. And I'll talk a little bit more about some of the things we've done in the past.
Thank you, Gina. Can you hear me? All right. Hey, Gina, thank you so much for that introduction to federally qualified health centers. I could not say it better. I would really like to. First of all, my name is Donnie Miller. I'm the CEO of a federally qualified health center in Toledo, Ohio. And special thanks this morning to Senator Sharon Brown for hosting this event, and to all of those amazing people who helped make this possible. This is so important. It's so necessary that we do this, that we come together in this way. And I am just so pleased to be here. When we talk about what we do at Neighborhood Health Association, in addition to the remarks that Gina gave, one of the things that we're doing in Lucas County, and one of the things that is that we're pushing health equity and health justice issues far more significantly than we have in the past. And that work for me is informed by one of my favorite quotes that I'd like to share with you. The quote is from Representative Robert Smalls of South Carolina. Mr. Smalls is no longer with us. In fact, he was a freed slave and a naval hero, and his story is quite amazing. And if you have the opportunity to check him out, you really should. But this is what he said in the 1800s that just resonates with my spirit every day and all day. He said, "My race needs no special defense, for the past history of them in this country proves them to be equal of any people anywhere. All they need is an equal chance in this battle of life." And I think about that all the time, especially when it comes to healthcare, because that is what we need, is an equal chance in this battle. And there are lots of reasons why, and we talk about these reasons in Lucas County all the time, social determinants of health, but it doesn't take a huge brain to know that if you promulgate policies that put folk in neighborhoods where there are older housing stock with access to lead, and there's no access to fresh food, and there's substandard housing, and you are living in a place where they aggressively engage in activities that are designed to suppress your vote. I mean, it doesn't take a whole lot to understand that the impact on our health is horrific. And then when you include those issues of voter suppression, you substantially minimize our opportunity to address these issues in a policy way, in any real way. So we at Neighborhood Health, and my personal work is to make people understand, by changing the narrative in Lucas County, that health is not just about your yearly exam. It is about the quality of your life across all sectors. It cannot be avoided. That conversation cannot be avoided. I also think that, and I hope we get to talk about this in more detail, because one of the things that we're focusing on at Neighborhood Health is making sure that narrative is front and center when it comes to structural racism. We've heard about it throughout the morning today. There is absolutely no way that we can change our position in this country around issues that affect our health if we don't address the structural racism that exists when it comes to our service delivery system. Medical schools that are slow to respond to the need to provide diverse opportunities, experiences for their students. Doctors, providers who are culturally uninformed and culturally irresponsible, and therefore culturally unresponsive. Those things are so important. We live in a system where they continue to promulgate, so push forward myths like Black people have a higher threshold for pain than anybody else. And there are a number of studies out there now that are saying, you know what, because those myths continue to move forward, Black folks are under-medicated. We're not over-medicated. You know, you hear all that discussion about us being pain seekers when we actually have sickle cell, or, you know, a number of other things that make us look like we are getting medication all the time that we shouldn't have, when the reality is that we're not getting it as often as we should and in the doses that we should because of what? Because of structural racism. My personal politics, and I have so much to say to you, but I'll end with this. My personal politics require me to remind women every chance I get that we have to understand our value in this process. We are the ones that hold the world on our shoulders. We take care of, we do for, we fix it all, we nurse, we nanny, all of that. We do all of that for the entire universe. And at the end of the day, where do we put ourselves? Dead last, every single time. And unless we learn that unless we are clear with ourselves and each other what our value actually is, and we find a way to honor that value in every single thing we do, this system will not move forward, because we, as Black women, are the ones that have the capability, the ability, the energy to address these issues head on, because that's what we do, y'all. That's what we do, and move it forward. Again, there's so much to say, but I know I have well exceeded my 2 minutes, so I'll stop talking. But I'm so happy to be in this conversation this morning. Thank y'all for being with us.
Good morning. Thank you for the invitation. I wanted to start by saying thank you. Are we getting feedback, or are we good on sound? We're okay. Great. Thank you to Senator Sharon Brown and to Renee Mahaffy Harris and the Center for Closing the Health Gap for bringing Black women together to have this conversation. I am Dr. Meredith Shockley-Smith. I am the Director of Equity and Community Strategies for Cradle Cincinnati. Mainly, I am leading the work of Queens Village. That work is about closing the health disparity on infant mortality for Black women who are losing babies at 3 times the rate of their white counterparts. And to do that, what we did was go to the community of Black women and ask them what they needed in order to close this gap, because we believe that Black women should lead, particularly in the spaces where they are suffering. So where we are now in that process, we've been doing this work 2 years ago. Cradle Cincinnati named racism as an impact, as having a negative impact on infant mortality. And so we have very clear conversations about racism and how that plays out on the Black body, and particularly Black moms. So when we went to the Black community of women and we asked them what they needed, they said, we don't feel heard, seen, or valued. And so we began to get to work amplifying their voices, creating a new narrative around what we understand Black women to be. And we are now listening to them and implementing much of what they've asked us to do. And I think we're going to get into details later, so I will save some of that for then. And then we value them by celebrating them. So you can see that happening on our social media. I mean, there are so many Black women, as you can see on this panel and in the panel prior, who are doing great work in Cincinnati and who are often overlooked and unseen. And so we're just sort of shining the spotlight on them. They also felt stressed and isolated. And so we spent a lot of time in the community creating relationships. So we know that isolation is a negative thing, and it is very difficult to carry the weight on your shoulders as a Black woman and perform all the things. I mean, it just keeps going and going. And then we're like, oh, hey, so welcome global pandemic. And let me also be a teacher while I'm in the middle of working and raising children, et cetera. And so the work keeps going. So I just want to repeat the thank you for this conversation. And I look forward to giving some examples of what it looks like to do the work.
Kyla, may I just make a comment here, please?
I'm going to get you in just, Councilwoman, thank you so much for being here with us. We're going to get you in just a moment. I'll come right back to you.
I gotcha.
I just want to have Ms. Charlotta introduce herself, and then she's the final one for introductions. I'll come right back to you.
Thank you very much. First of all, I'd like to thank Renee Mahaffy Harris and Closing the Health Gap, and certainly Senator Sharon Brown for providing this opportunity. I want to say good morning to all my African Black sisters. A beautiful morning, but it's more beautiful because of each and every one of you that I see and that I saw on the previous panel. Certainly Aaliyah Brown, thank you very much for bringing us all together. I'm Charlita. It means little Charlotte. My mom's name was Charlotte, Charlita Tavares. And I am the CEO of Primary One Health. I am proud to be one of the FQHC Black sisters that are on this morning's panel with Gina and Donnie. We are proud to be leaders in the federally qualified health care movement, a movement started in South Africa back in the 1960s when two physicians went to South Africa and saw their community health experience and brought it back to the United States. And we were a part of the war on poverty with President Johnson, who signed the bill in 1965, creating the federally qualified healthcare system. My healthcare center, Primary One Health, is the second largest healthcare system, a federally qualified healthcare system in the state of Ohio. We served over 48,000 patients last year. Proud of that, but there are still so many unserved, underserved residents in my community and throughout the state of Ohio. And that's why we're growing, because we serve everyone, as Gina said. We serve any and everyone, whether they have any form of insurance or not. We provide comprehensive health care, including dental and vision, and we also provide physical therapy. Donnie talked about pain and pain with sickle cell, and how we're sometimes thought of as pain seeking for medication. Well, what we know is that we have very serious illnesses and diseases that are painful, whether it's sickle cell or fibromyalgia or lupus or other diseases disproportionately contracted by African Americans. One of the areas that I'm most proud of with Primary One Health is our ability to pivot not only to telehealth during the pandemic, but also to pivot and start testing for COVID-19. Our sister organizations across the state, there are 56 of us across the state, have been testing and really focusing in on racial and ethnic populations who were under-tested in the beginning of the COVID pandemic. And so we have tested over 14,000 individuals at Primary One Health. The community, in fact, we have a pop-up going on right now with one of our churches. It's important for us to understand that we're not just providing health care as FQHCs, we're also addressing the social determinants of health. We have what's called community health outreach workers, and Vanisha is a community connector, which is a community health outreach worker. We have them that connect our patients through what we have, the Pathways Community Hub, to those other social services, housing, employment, the connecting, 20 connecting points to address the social determinants of health, to help address better health outcomes for our patients. The one thing that I would say as a community-based health center, we can't do any of the work that we do without having strong connections with our community partners. None of us can do this by ourselves. it is critical that we are connected to the communities that we serve. We also are involved in public policy along with our other FQHC sister organizations. We do quarterly what we call community health outreach breakfasts, where we do a focus on each of the social determinants of health to bring that information to the community. We're doing them virtually now, but to provide that information to our community and to help them get the information so that they can advocate for themselves what it is that they need. And I want to thank you again.
Thank you so much, Charlita. Thank you for the correction on your name. I really appreciate that. So I'm going to go back to Councilmember Kearney, so you can go ahead with what you were going to say, and then we'll get to our questions.
Okay, and I was going to say, Senator Tavares, my husband said, make sure you don't call her Charletta. You know, it's Charlita. I'm like, I know. I remember you in the Senate. You did great work. So, I just want to say, I'm just sitting here getting so excited about all this information we're getting. And when Dr. Meredith Shockley Smith was talking about infant mortality rates and how they're higher in Black women. And then I thought back to what Linda Blount told us earlier, that racism causes stress, and stress causes a 15% increase in that stress hormone, cortisone, which leads to low birth weight babies. And it's like, there are all these connections. And I'm just thinking we've got so much information coming to us today, and information is power. So, I'm just really excited about making those connections. So thank you, all of you, for that. That was my only comment. I just couldn't wait to say it.
No, I share your excitement, Councilmember Kearney. Thank you so much for that. I said way early in the program, that I wish we had 6 hours for that. I mean, so many things that we could cover today, so many wonderful experts, and we're covering so much ground, but this is a very important starting point. So we're going to take everything we learned today. We're going to continue to inform and equip and empower ourselves as Black women so we can help change our communities and change the world. So I'm as excited as you are. So thank you for sharing that. Let's go ahead and get to our questions. Before we do that, everyone, as you're joining us virtually, thank you for coming to the inaugural Ohio Black Women's Virtual Health Symposium. This is a part of the Black Women's Health Movement powered by the Health Gap here in Cincinnati. We're so grateful to Senator Sharon Brown and Aaliyah Brown and their staff for coordinating this effort today. And we're grateful for all of you for attending. We want to make sure your voices are heard. As I mentioned, we're covering so much ground. So please, if you have a question, share it in the chat along with your name and where you're writing us from, and we'll try to get to that. We also have a form now that you can see from Sarah in the chat. If you would please share your feedback and information on that form as well, so we can make sure that we have that on our end. So let's get to our questions, and then we'll get to chat questions. So if each of our panelists wouldn't mind to share your thoughts on this particular question, we'll try to be brief. I know, again, it's a lot of ground to cover, but if you could try to keep it to 2 to 3 minutes. One of the objectives of this symposium is to connect the dots for people between issues like gun violence that we heard Councilmember Kearney talk about, lead exposure, poor or inadequate housing, income inequality, all of those non-health issues that are adversely impacting Black health and Black women in Ohio. Could you please spend a few moments just sharing how we can address those issues in our communities? And we can start with Councilmember Kearney, if you want to go first, and then we'll go to Charlita, and then we'll go to Gina, and then everyone else, please feel free to chime in.
Thank you. Well, yeah, there's so many issues we have to address. And so, let me just start by saying the task force on systemic racism is very, very important, because there are systems in place that permeate Black and Brown communities, low-income communities, and keep us in these situations that are, just not tenable. And so these systems have to change. I've already mentioned some of them, like, home ownership. Here in Cincinnati, we're finding a lot of problems with people losing their homes because, anonymously housing code violations are being reported. Homeowners sometimes don't have the money to fix them, and they find out that these fees get put on their tax bills, and they end up getting foreclosed on. Some of them get taken to court. I mean, it's really a very difficult system, and it's got to change because people are losing their homes. Also, we need people to be able to buy homes. I mean, that is a way of building generational wealth. In terms of gun violence, we have people debating what's the best solution for that. Personally, I don't believe it's more policing. Cincinnati has a good police department. It's gone through a lot of changes over the years, thanks to the collaborative agreement. However, I still don't think that more aggressive policing is the key. It's really community members and some of the agencies and some of the services that are underfunded that we really need to look at in terms of giving more funding. We need to, talk about economics and jobs. A lot of the gun violence that happens because unemployment is up. A lot of people say, oh, isn't it because of gangs and drugs? A lot of the gun violence that has happened here recently, it's out of personal disputes. Sometimes it's out of, things like high stakes dice games, frankly. I mean, because people are broke. People need money, they need jobs. And so starting with jobs for youth, but, we have to move on to, include as well jobs for other members of our community. I mean, people need to work. They need the dignity of work and definitely the income. And so that's also why we're talking about supporting businesses, because a lot of families depend on small businesses. And it's really important that we support small businesses, support Black businesses so that people can take care of their families. We mentioned some other issues like environmental issues, and you talked about lead poisoning. That's a huge issue because so many of us live in these neighborhoods, with these beautiful old homes, but they're old homes and they have lead paint in them and the lead paint chips. And then, the children eat those chips. And, it's really, this is, the lead abatement is another issue we really have to work on. And just to not take up too much time, but there are a lot of environmental hazards in Black communities. And one of them that we're working on here in our area is getting this gun range out of Lincoln Heights. The gun range has been here forever. The community has grown up, and it's time to move. We have to get it out of there. It's a hazard for our children. It's a hazard for the entire community. And so, a lot of things we have to work on, and we are in process.
I want to piggyback on what Jan Michelle has just shared about some of the issues, certainly the social determinants, and that's why I'm a big fan of the Pathways Community Hub program. I was proud to be a legislator who helped to get the funding into the Ohio Commission on Minority Health's budget. They are the entity that basically designs the program throughout the state and funds the new Pathway Hub programs. We need more funding in order to develop more hubs across the state of Ohio. The hubs act as a way to connect individuals to all of those issues that they're dealing with. And unfortunately, people who are disproportionately poor have challenges. And they have challenges with housing, they have challenges with unemployment or lack of employment. They've got challenges with the environmental issues. Many times housing is in those areas that have industrial complexes that are spewing toxins into the air. And so you've got a higher number of individuals who have asthma or respiratory diseases. And so the Pathways Community Hub program here in Franklin County, it's called the Healthcare Collaborative of Greater Columbus. And they are the Pathway Hub leader. And then they identify other agencies that are going to work with them to connect people to those other points, those spokes in the wheel, so to speak, whether it's healthcare, whether it's housing, whether it's food insecurity, whether it's employment. They're going to connect them to those other spokes. And it's been very successful. And the reason it's successful because it's based on performance. Funding is based on performance. And that's how you get the best outcomes. you're ensuring that that person, that individual and family are connected to those services that they need in order to be healthy and whole. So I'm very, very fond of the program. I think as advocates, we've got to make sure that we continue to grow those throughout the state of Ohio and that the existing hubs are supported so that we can support the people within our community.
I would add on a couple of other things, especially in the Dayton community, and as well as it's all over Ohio. We have a food desert that's going on. Within the core city, there are just 2 Kroger's grocery stores. And so we're in the midst of working with Gem City Markets. It's a cooperative group that's working on actively building a brand new grocery store right in the middle of West Dayton. And so we're pleased to say that we will be one of their partners in this particular venture, and that we will have primary care as well as an acupuncturist who will be available to provide care to as well. One of the other areas that we're dealing with, as we mentioned before, is just the whole issue of housing. So it's not just a matter of getting a house or getting an apartment, but for a lot of our patients, they can't afford the down payment. They cannot pay off the utilities that someone else put their name on previously, and so they can't even get housed. And so we actively work with our patients through our Healthy Start program, and we're one of 5 Healthy Start programs within Ohio and 1 out of 100 in the nation. And through that Healthy Start program, we really try to embrace all of the different issues that are going on from that social determinants of health perspective. And so one area that we've done incredible work has just been in helping patients finish their education, get a job, letting them know about some of the training that's out there in order to bridge that gap of income inequity. But probably the area that probably hurts all of us collectively the most is just if you look at just the epigenetics of just racism that we all have to deal with. And so when I think about my grandmother who gave birth to 10 children, and my mother who was inside of her when she was giving birth, and I was inside of my mother, that small little egg, all of us felt that same tension that she was going through as she was trying to figure out a way to pay for all of the different mouths she had to feed while she was scrubbing floors, as being just one of the strong African American women that we embrace and we look at. And so I think for us, that chronic stress of being African American is just something that we have to at least understand and embrace and realize that sometimes that patient that walked through that door and it looks like they're upset and they're mad, well, did you know they had to take 3 buses to get there and they had their 2 kids? And here we are, we're just asking them, hey, can I get your insurance card? And so sometimes it's a matter of showing compassion, showing people the kindness that sometimes they're just not getting when they walk on that bus or when they come outside of that door every day. And so it's all of those things collectively we can work on. And today, as we talk about housing, 5 Rivers Health Center's employees, we're out helping Miss Francis paint one of her homes today. She's one of the people who volunteered to have her house painted as a part of rebuilding together. And so it's what we all can collectively do to help each other that we're going to make a sustainable difference in all of our lives.
Yeah, totally agree with things that Gina said. And one of the things that I might add is that instead of looking at those issues that were identified in the first question as being disparate issues, I would say that those are all healthcare issues. And I would encourage you to look at them that way. There is a model that's becoming popular in the country, and it's one that I'm trying to figure out how to begin a discussion about in Lucas County, called Healthcare in All Policies model. And what it essentially does is says that all of those issues, gun violence, environmental issues, all of those issues that were named in that question are actually healthcare issues, and that health should be considered primary in the development of every policy, every issue that we discuss, because at the end of the day, all of those things have an impact on our health. It's called healthcare and all policies. And it's really interesting a way to look at those social issues that we are treating differently than we should, because we're not considering their actual impact on healthcare. One other thing I wanted to say, Gina says the most amazing things. It gives me all this opportunity to talk about all these other things I want to mention this morning. The continued stress that we feel as Black folk. It's actually been given, the impact of that stress on us is actually called weathering, by one of the professors that is not far from me up at the University of Michigan, coined that phrase more than a decade ago. And it talks about, in geology, weathering is the wearing down of the earth because of its constant exposure to erosion, those elements that erode. And that is exactly what it does to us as Black folk, that constant exposure. And we don't really think about it because we are just accustomed to dealing with it and getting through. But it really does have an impact on your system, such that it causes us to be more susceptible to things like autoimmune diseases and diabetes and all of those comorbidities that we hear about all the time, hypertension. There's even some discussion that it is that weathering that can cause biological changes in Black women that contribute to high rates of infant mortality and infant morbidity. So we have got to find a way to effectively and efficiently, because this needs to happen soon, begin to change the foundation of structural racism.
I just wanted to jump in, if that's okay, because I really liked, when Gina mentioned food deserts, and I just want to say, and a lot of things you're saying, Donnie, too, and Charlita, because I was just looking at, there was a study done by the Urban League several years ago here in Cincinnati, and they looked at life expectancy in different neighborhoods. And, nationally, we all know that our life expectancy as Black Americans is about 4 years less than white Americans. But we have neighborhoods here where in low-income Black neighborhoods, our life expectancy is like 18 years less than white Americans in more affluent neighborhoods. I mean, it's just huge. And so, Donnie, when you're talking about, looking at health in every policy, I mean, that is so important because it permeates everything.
Everything.
And then food deserts, that is a huge issue. If you have to take 2 or 3 buses to get to the nearest grocery store, you might end up down the street at, KFC or, White Castles. And, no offense to those restaurants. I eat there too. But we need healthy food. We need access to healthy food right here in our neighborhoods.
Mm-hmm.
Thank you so much. All of those, like we said, connecting the dots between the several different areas and several different industries and everything that compiles to make those outcomes what they are, and how do we address those? I think we still need to hear from Marcia and Meredith. We'll go to them and then we'll come to our next question.
Sure. I would like to pull from the chat and shout out the hubs that are happening. So some of the things that happen in communities are that we don't get the message to the people. And so community health workers are doing such a great job at taking all of the information and all of the great work that's happening at the top and making certain that moms and families know where they can get services, where they can get support, how to advocate for policy that creates change around food desert or safe communities. And so for me, I think the connection of the dots that Kyla just referred to is also a part of connecting the dots from the top to the ground. And so that's happening there. So thank you to the hubs who are doing great work, particularly in Cincinnati, and community health workers who are going very hard every day, all day, to make certain that folks know how to get what they need.
I too want to thank everyone. This is rich conversation. One of the things, though, I'd like to first of all thank Donnie, because one of the things that I definitely try to drive home in the work that I do is that we are not in 50 fights. We're not in 50 different fights with one round. We are in one fight with 50 different rounds. And we have to be able to talk about the threat of this ecosystem and the fact of how inside of this ecosystem that we live in, which is racial, economic justice, climate change, and all of these other things. It's a thread. It's just a thread that continues to be interlaced with the problems that we face today in our societies, in our communities, and upon our bodies as Black women. So I can really appreciate that. And all of the women here who are doing FQHCs, I actually owned a clinic when I lived in Michigan. What I'd like to do is kind of shift this a little bit when we talk about the fact of non-health issues, because we have not mentioned, one, the spiritual health of people, which is attached also to their mental health. The other thing that we are not talking about is the trauma. As Black women, we deal with in our communities as well. We deal with transgenerational, multi-generational, generational trauma that we carry in the larger parts of our bodies. And because trauma steals from us, sometimes we don't even know how to name and claim, what's bothering us, or to be able to talk about it when we go to our doctors, let alone, not having enough Black therapists in Ohio. I know when I lived in Toledo, my job has carried me through Ohio. When I lived in Toledo, it was hard to find a Black therapist. I didn't think we had any. I couldn't find any. But we also have to look at the fact that we don't have a living wage in Ohio. And one of the things that helps to bring, people to a point of reducing some of these stressors is provide a living wage. I saw someone who had a sign that said, "It's a shame when unemployment pays more than corporations," and at this time of COVID. And that is a shame. And so we need a living wage. We have to look at the other traumas that we don't even lift. I believe it was one of the councilwoman from Cincinnati who lifted criminal justice. We're not talking about the collateral sanctions that Black women are subjected to when they come home, and the fact that the reason why they can't get a good job is because they have these silent barriers before them that policies don't allow to be taken away or reduced. And even though there's options there, these options still lead to a point of unaffordability. And then lastly, I think we have to also look at some of the normalized ways that we have allowed these stressors to land upon our bodies and stay there because it's been culturally imposed upon us. And so when I think of the word strong Black woman, that puts a whole lot of pressure on us as Black women sometimes, because we feel like we have to be in movement. And then we have a values-based living that then declines our worth, that then takes us into a point of depression. And then we're kind of spiraling down in our own mental health as well as our physical health and our spiritual health. So I think that there are some things that, even when we talk about small steps, it is changing the narrative and driving the narrative that not only talks about public health, but that just talks about health, period. And when we can get into a deeper conversation in the health and understanding that this started and landed on our Black bodies through objectification and commodification and continues to repress us in all areas, we're just going to be tapping the nails on the head, but I don't think driving real things home. And to wrap this up, policy is great, but we also have to have a clear analysis of what the policy is, and then understanding that inside of some of these policies, there are other policies that we have to break down. So what are these things that we can think through on every level, locally, county, state, and federal, that we can begin to build up so that we can have a redistribution of power, and we are driving the change that we want to be and that we need to be and that we know we can be because we always have been as Black women. Thank you.
Ooh, response to that. Absolutely.
Absolutely.
We are
Thank you
driving
all
the
so
change. That's so important. We are driving the change. That's a key point right there. Yes.
Yes, it is. Yeah,
And that's why we have to vote. And that's why we have to vote. We can't ignore this election.
We cannot afford to. No, absolutely not. We have to, and I love your necklace. Charlita, yes, I see you. I see you. We love that necklace. We all have to vote. We have to empower ourselves. We have to take part in all the processes, the electoral process, advocating for our health, our physical health, our community health. We are the glue that keeps it all together. We know that as Black women. That's why we're having this event today. So we're going to keep the program moving. I know we have so much wonderful content that we're getting to today. So that's why we'll make sure that we are dropping the link in the chat so everyone can follow up with one another. To our panelists, if you could put your email address and your social media handles for us, please, in the chat so everyone can have access to follow up with you individually. Our final question before we get to our last virtual workshop, this question talks about solutions. So we've talked about the problems, we've identified the problems. Now we want to talk about solutions. So if each of you, and I'm going to again beg for a hard 2 minutes, I know it's really difficult, but if you could try to keep it about 2 minutes, what successful programs or initiatives exist in Ohio cities or maybe even in other states that you've seen that we should look at expanding and replicating?
Well, you know what? Let me just jump in because I'm probably the newest person to all of this. But you know, one thing that we do is we look at what tends to be working in other places, and so I just wanted to mention. I just heard something really exciting this week from San Francisco. Mayor London was talking about London Breed was talking about an issue of Black women dying in pregnancy and the high rate of infant mortality, which Dr. Meredith Shockley-Smith was talking about earlier. And she said, I'm just sick of hearing this argument. I'm sick of this debate. We're going to start giving $1,000 a month to every Black and Pacific Islander pregnant woman through their pregnancy and 6 months afterwards. And I'm like, wow, that's, that is really strong. I mean, she said, let's stop arguing about it. People need money. They need economic ability to get good health care, to live in healthy places. And so I just thought that was wonderful. And so we're looking at what others are doing. Here in Cincinnati, as I said, well, I didn't say this, but we are starting a fund to give homeowners money to actually fix up their homes. I mean, they're housing violations, they lose their homes through that. Violations need to be fixed. And so some people just don't have money for that. So we're trying to get a fund for that also to increase home ownership. As someone mentioned, I think it was Gina who mentioned, people need down payment assistance. They need assistance with that. So we're working on that. As I said, we're working with the juvenile probation system here in Hamilton County to identify youth, to get them into jobs, to get them out of that criminal justice system and into jobs. So that's really important. We have some great community groups here. One is SERVE, and it's the community initiative to reduce violence, where they actually, they work a lot in different areas. But one thing they do, they're community members who are out in the street, walking the streets, trying to stop problems from happening. It's more preventive. They really need more funding. And so, that's another thing that I mentioned. There are groups out there doing great work, but they need more funding. And so when we talk about gun violence and how to stop it, it's not more aggressive policing. We need the community involved, and we need to fund these groups that are out there. So there's a lot going on, and I'll just mention those few.
I'm going to piggyback on that because you already brought up infant mortality. So in Cincinnati, some of the work that's happening, Children's Hospital put several of their resources into Avondale in a program called Start Strong. And that program is kind of a mirror, Cradle is kind of a mirror from that program. For 3 years, there was 0 extreme preterm birth. So what we know is that program was working. And so Cradle was created to expand that work to all of Cincinnati. So when Queens Village Work, which is the work around Black women and the disparity, started to allow Black women to lead, we saw the numbers in infant mortality drop. And so last year, we saw the lowest numbers of Black infant death in Hamilton County's history. And so what happens in that space for me is about Black women leading, as I started. So when you give them the space to solve their own problems, they do. We know that about ourselves. And so some of the things I think that need to happen in addition are that we continue to create relationship with each other and support each other. We come from that space of a village, which is why it's called the Queen's Village, supporting each other through all of the things and efforts that we needed to. This isolation piece is certainly not our history for certain. And I also want to give a significant shout out to funders who give flexible funds. So it's very difficult to try and fix a problem with somebody else's solution. So when people like BI3 or Greater Cincinnati Foundation offer money and say, you take these funds and do with it what you know is good, and when you bring back results, we'll continue to fund that. So I would just offer to funders that you allow those folks who are going to receive the services to have some say in how it will happen, and to continue obviously looking at what those results look like. For example, the Ohio Department of Medicaid, when I said I need some accountability to folks who are getting Medicaid money, so we have what we call community advisory boards, or several of them in Cincinnati. They're all Black women. And when the Ohio Department of Medicaid gave money to Hamilton County, they asked the Board of Women to prioritize who gets those funds. So the proposals were written to them. So if I am writing that, if I am receiving those services and you now have accountability to me on whether or not you'll be funded, then I have some accountability to whether or not I will do that work well and with integrity. And so there's, not just a matter of getting women together and creating space for them to rest, relax, repower, or to hear, see, and value them, but also to hold accountability around us. It is unacceptable that you would be funded to change this, in 30 years later, the situation remains. And so I'm excited about this movement and this space where we are standing on the shoulders of giants and expanding, and I appreciate all of you doing this great work. And to the last question, I also wanted to add that thread that Donnie was talking about is a collective impact. And so we are already working together. So I really appreciate getting to see people's faces and names and watching people's emails pop up in the chat so that we can continue this conversation, because I see this as a collective impact.
I would add in, just to piggyback on the infant mortality, again, our Healthy Start program has made a significant impact in this community. But more importantly, we have the data to show it. And so, part of that whole accountability piece is making sure that you are doing what you're saying you're doing. You're using the funds for the things you said you're going to use the funds for. And so that's one of the ways that we can continue to do things. We also created a sickle cell clinic. One of the things that we learned is that a lot of children, when they have sickle cell, could not find a provider who was willing to provide pain medications to them. And so adults were going to Dayton Children's Hospital. So we created a transitional adult sickle cell clinic. And so what we do is we provide the guidance for that patient, as well as for the next provider that they may see, that, listen, this is truly legitimate pain. Please give them the proper medications. One of the things that through the COVID period that we did is that we partnered with a group called Produce Perks, in that we wanted to make sure that our pregnant women had organic, great food and vegetables every single day. And so on a weekly basis, they could come to us, or we could Uber Health those groceries to them and leave it on their doorsteps, put a little recipe in it. And what we saw is just a significant difference in patients eating more vegetables, being healthier, having better birth outcomes. All of those things help in the long run. But I would say one of the things that we probably need to work on, and it's something difficult that people don't really want to talk about, and my friend in Cincinnati touched on it a little bit, and it's the whole issue of financial wellness. For a lot of
Gina,
a lot of the people that we deal with, it's a matter of how they can pay for what they're living with. And so we have to talk about the issue of reparations one day. And it's something that is very important to all of our patients, and it's very important to me too as well.
Yes, thank you so much, Gina, for that important insight as well. We have a lot of layers to cover, as we've been saying throughout our time together. We do want to be really mindful of that time, and we just have to make a quick adjustment. So we're going to ask our panelists to please stick with us for a moment. We're going to jump to our virtual workshop led by Christy Coons. Christy is the Chief of Staff and Vice President of Operations and Community Relations at UC Health, and she's also a former Ohio State rep. So we're going to hear from Christy. She's going to empower us here over the next few minutes, and then we're going to jump back to our panelists for some final thoughts before we end the program. Thank you all so much for your grace and your patience. And please welcome Christy.
Hello, everyone. I am going to try to get through this and keep you on schedule as much as possible. It's a pleasure to be a part of this with so many great people. Thank you to Senator Brown and Aaliyah Brown and the Center for Closing the Health Gap, Renee Harris. So this presentation is really about taking the information that you've heard today, passion that you may have about the different things that we've talked about, and how do you take it from the anger and the passion to action. And so, next slide, please. So when you think about engagement, when you think about, and I had the quote on the first slide that when President Obama said, "Don't boo, vote," what are ways that you can get engaged? So what comes to mind when you think about connecting with decision makers? And, for some folks, when they think about reaching out, whether it's to an elected official or a CEO at their company, sometimes you feel intimidated. And what you have to always remember, particularly when you're talking about elected officials, and having been one and served in the House, I worked for my constituents. It wasn't the other way around. So they should never be intimidated to contact me about an issue, because that was my job. That's exactly what I was sworn in to do, was to address those issues. And so you need to kind of approach it from that standpoint. And a lot of times you have to remember that some of the people that represent you, they're not experts on everything. And so they need you to educate them on what it's like to live in your particular area. If you are an expert in infant mortality, then you need to connect with them so that you can educate them on the issues that impact infant mortality. So make sure that you're not intimidated and that you're using yourself as a resource to those folks who are making decisions that impact you and your family. And then how are you engaged in your neighborhood, city, county, town? So it's not just everyone says, don't just vote in the presidential election. Now you understand how important it is to vote in the Senate elections, for the House, for your city council, even your neighborhood community council. There are resources and development decisions that happen at your community council level. And for developers who are looking for public dollars from your city or your county or town, they look to that community council for a letter of approval to say that they've gone to your neighborhood and talked to them about the project. So are you even going to those meetings to understand what your local community council is voting on that impacts you where you live, where you pay for your mortgage, if you rent, whatever the case, you need to start local. And with your place of employment, there's lots of things that every corporation out there released a diversity and equity statement after the murder of George Floyd. And, they're going to start making decisions. And are those decisions going to be in line with those diversity and inclusion statements that we saw come out from all of these corporations and companies and et cetera? And so, are within your own workspace, are you reminding those who are making decisions of the major big statements that they made just a few weeks or a couple of months ago? And then just making sure that you're familiar with who your local, state, and federal government representatives are. Regardless of party, they still work for you. Your taxpayer dollar still goes to support that function. And so you still need to make sure that they hear where you stand on issues and what your expectations are. And like I said earlier, make sure that you know what you want to gain from those interactions and don't be apprehensive about reaching out. Next slide, please. And so I've mentioned a couple of these things, but ways to get involved. So first, think about what's important to you. When we're talking about Black women, we know that we do it all. And a lot of us, we're overwhelmed. So the first thing I'd like to say is if you can't get involved in all of these different things, that's okay too. This is for someone who has the time, who has the ability and the desire to do these things. These are some things that you can get involved with. If you're already up to here, don't feel like, oh, I have to do these. You don't. Okay, so if you're interested, some things that you can do, you can call, email, and write your representatives when issues come up or there's legislation that's pending that you'd like to have a say in. You can start and sign petitions. You can join advisory boards and commissions. There are tons of advisory boards and commissions in your local area. Usually you can look them up on your city or county website. And if there's an area that you have a particular interest in, there's the Recreation Commission, there's the Public Library has a board, there's all of these different things. Look and see if there's something that you have a particular interest in. Find out the person who's over that board or commission and get more information and decide what the process would be if you're interested in joining it. Political organizations, if you want to be involved in a political party, join that local party, get on a committee, help with candidate recruitment. There's tons of things that you can do, volunteering for campaigns. Obviously, we have the big election coming up, and the deadline to register to vote is October 5th. So even doing a small push within your family to make sure everyone within your family is registered to vote by October 5th and that they have a voting plan in place. That's a small organizing effort that you can do that you can do just within your own circle, and it will make a huge difference. And then mobilize and protest. So we talked about even with community council, if there's an issue that's coming up and you and your neighbors aren't happy about it, mobilize the folks on your street, the street behind you, and you guys can say, no, we don't want this development to happen unless there's a community benefits agreement in place that spells out exactly what we will get from supporting this project with public funds. And so there's many ways that you can get yourself involved in issues. And I will pause there because I think it's most helpful for me to answer specific questions that folks may have about how to get involved and how to advocate.
Thank you so much, Christy, for that information. One thing you mentioned there that I think is extremely important, and I'd love to dig into that a little bit more, is really just getting involved locally. A lot of times people sometimes hear politics or they hear, organizing, and those feel like these big words. And it's like, I don't know if I want to be involved with that. Just go to your community council meeting, right? Like just starting with your neighborhood community council. So can you just talk a little bit about, what are the best places for people to learn about how to get engaged there and how to really make their voices heard in those environments?
So I served on a community council for over a decade, and we can stop the presentation. I don't have any more slides. And it was very easy to do. You just, you go to the meetings and to become just a member, and then you find out when the elections are occurring, and you run for election. And it's more than just beautifications, which are fun too. But there are some pretty significant things that happen there. Typically, you'll have like your police officers, your neighborhood police officers will come to the community council meetings and talk about safety and what's happening in what trends they're seeing with respect to crime and things of that nature. So there are the issues that really impact you day to day. Whereas when you go up higher levels, you may not see those issues as immediate and day to day as you will the ones that you'll encounter on the community council.
Yep, that's exactly right. And I think one thing you'll learn more as you get engaged at that community level, you'll see that that's where you can really have your voice heard and make the impacts. You might go to your kid's school and, you're upset with something there, or you might want another stop sign in your neighborhood. How do I get that additional stop sign? How do I get more monitoring? So I think we just have to, again, through platforms like this, understand that getting involved and doing that at the community council level, it doesn't always have to be at city council and at the state level. But then also supporting our leaders who are leading that work there, sending them emails, making your voices heard in that way. That's another way that we empower ourselves to be advocates in that area as well.
Mm-hmm. Absolutely.
I just want to pitch in and say that is so important because when developments come before city council, we always say, what does your community say? What did the community council say? And so that is super important. And we love for more and more people to actually be involved in their neighborhood councils.
Thank you so much. And Christy, we want to be really mindful of your time. We appreciate you being able to adjust for us for our programming today. And we really, really value all of your insight and helping us turn that anger into action and get on the ground and get out there to these community councils and make sure that our voices are heard. So thank you so much to Christy for leading our virtual workshop there. And we want to go to our panelists as well. I know there were a few of you that we did not get to hear from. We'd love to have closing thoughts regarding just how we continue to make our voices heard and how we make sure that we are advocating for those issues that a couple of you said, we're calling them non-health issues, but really they affect our health. And so they are health issues. So what are some of those solutions that we can bring to our community? If you could just give your closing thoughts on that, and then we'll wrap up our time today.
This is Charlita Tavares. I would like to share a couple of really well thought out programs that I would like to lift up. One is, it's called the Veggie Van, and Gina talked about food, and food is health. Food is one of the most important nutrients we can bring to our patients and to our community. And the Veggie Van comes to our health center, and it's specifically working with pregnant moms to make sure that they have the fruits and vegetables that they need in order to be healthy, but it's also there for our staff, and it's there for the community residents. They can use their EBT cards, they can use their prescription RX, their food RX card, where we give out to our patients, particularly those with hypertension or diabetes or overweight issues, where they use that card and they can go to any of the food pantries within our county and receive those fruits and vegetables once a week. But the Veggie Van comes to the health center site, and specifically, as I said, to serve the pregnant moms. The other area that I think we really need to focus in on, and it was mentioned in the chat box, and I think Donnie brought it up, is health equity in all policies. That's critical if we're really going to address not only health outcomes, but the community's overall health. We really have to have policymakers at every level, at the local, the state, and the federal level, to adopt health equity in all policy legislation. This is looking through a health lens at any rule, any legislation that goes before the council, that goes before the state legislature, or that goes through the federal Congress, that we make a decision with our eyes wide open, that we're going to look at the impact that policy, that rule, that legislation has on the health outcomes of individuals within our community. And for those of us who are African Black, it's more important for us because we're going to have to see whether or not it's going to have a disparate and unequal outcome for people of color. The other that I would just ask us to really push hard for, the federal government has adopted, the HHS, Health and Human Services Department has adopted what's called the class standards. Many people aren't even aware of the standards. These are very strong standards. It's called cultural and linguistically appropriate standards. That's what the class, CLAS, in healthcare. If we adopted all of those recommendations as well as requirements, we would be a much healthier nation, and specifically African and Black women would be much healthier. And then finally, I think we have to be intentional about developing a diverse workforce by our recruitment standards, our retention standards, and our promotion. We are intentional at Primary One Health at looking internally to promote within before we look outside. We are disproportionately women-led. 86% of my staff are females. And what's really of note is that disproportionately, they're women who are single heads of household. So we do not pay anyone less than $15 an hour, and very few make $15 an hour here at Primary One Health. You have to do what you can where you are to lift up African Black women. And that's how we're doing it at Primary One Health.
Thank you so much for that, Charlita. We probably have time for one more. If one more panelist wants to give final thoughts to close us out, and then we'll wrap up and we'll give a bit of a brief preview of next week's part of the symposium, and then we'll wrap up for today. Any final thoughts?
I can say something really fast. So, you know what, I just want to say, I think it's so important, and this is going to be counterintuitive, especially to Black women, but we have to take care of ourselves. So just remember, when you're sitting on a plane and they tell you if the oxygen mask comes down, you put it on yourself first, and then you're able to help other people. So please don't forget, take care of yourselves first.
And if I could just add one last thing, and it's really quick, I would encourage us when we get tired, and I know we do, we have to allow ourselves to say those names. We need to say Breonna. We need to say, we need to say George Floyd. We need to say Trayvon, because saying that stuff out loud, screaming out loud, is so much better than holding it in. And it really does help us when we're talking about that weathering and that stress that we continue to support, we continue to carry. So say those names, gather that strength. Charlita, what you said was perfect. I support that 1,000,000%. And thank you for letting me be a part of this conversation today.
Thank you so much. That's a wonderful way to round out our time today. I want to thank all of our panelists, all of our speakers, all of you for attending. We, of course, want to thank Senator Sharon Brown for helping to organize this, his Aaliyah Brown as well in his office. Thank you to Renee Mahaffy Harris, CEO and president of Closing the Health Gap, and the Black Women's Health Movement that they are leading. Please make sure that you're following on social, Black Women's Health Movement, powered by the Health Gap. So we have to make sure we're caring for ourselves and caring for one another, and then we can continue to care for our community. So a little bit of brief insight into next week. Next week's event will run from 10:30 a.m. until 1 p.m. So please stay tuned for that. We will hear from Congresswoman Maxine Waters, and she will speak about the importance of our mental and economic health. So you can find out more about that. It's in the chat as well, but go to Senator Brown's website, brown.senate.gov, for more information. Thank you for joining us for the inaugural Ohio Black Women's Health Symposium. Again, my name is Kyla Woods. You can find me online at Kyla Woods TV. I'd love to connect with you all there, and thank you so much for your time today. We'll see you next week.
All right.